Good morning, everyone. Thank you for joining us. And we are presenting you a deep dive into the USMLE Step 2 CK preparation, uh, brought to you by all the high scorer panelists. They will introduce themselves. Poorvi.
Yeah. All right. Hi, everybody. I am Poorvi Agrawal, and I am currently rising PGY2 at University of Florida in Pediatric program. Just a short introduction about myself. I completed my post-graduation in pediatrics, followed by pediatric endocrinology in India, after which I had this insight of trying this path. So I was working throughout. In fact, I had my own clinic when I was giving the steps. So of course, I had very limited time frame and limited study hours in the day that I could spare for my study. I somehow navigated my way well because the scores turned out to be really good in spite of the very short time frame that I had. Um, so I understood that there were some things that I was doing right that I could share with everybody who is also in the same position, similar position, with the limited time constraint, and can probably help from the tricks and tips that I have, and certain wrong things that I did which should not be done. So anybody who feels that can connect with me with the similar situation can probably benefit from today.
Thank you, Poorvi.
Mhm.
Devam.
Hi everyone, my name is Devam Maity. I am an incoming PG year 1 at Rochester General Hospital in the internal medicine program. I graduated in 2020, and after that, after my internship is when I prepared for my steps. So I had dedicated time separately for the exams, so I could give them within a little shorter time frame, I think. And I had a very personal, different way of studying, I feel, compared to most people. So that helped me score clearly. And I want to attempt to share some insights of how it works if someone connects with it and helps them on their journey.
Thank you. Mati.
Hello everyone. I'm Mati. I graduated from King Edward Medical University in year 2021. And after that, I joined Beth Israel Deaconess Medical Center as a postdoc research fellow. And regarding my USMLE journey, I did my USMLE steps during my medical school exams, where I had to kind of tackle both my USMLE steps and also prepare for my university exams. So I think with the pass fail of USMLE, and currently that the USMLE pathway is pursued by many graduates, and I think most of them are trying to do it during their graduation in order to save enough time. So I feel that my experience may help some of you guys who are actually trying to do it as early as possible. And I'm willing to share my experience and help you through this platform today and share our experience and see if our experience or my experience fits you, then you can get benefit of it.
Thank you, Mati. So, so we have all spectrum of panelists. Someone who has done during the medical school, someone who's done step 2 CK preparation during their job, and someone who has done step 2 during dedicated period as well. So we will have all kind of perspective. And myself, I'm Arjun Kelaiya. I met at Mount Auburn Hospital in Cambridge in internal medicine. I also scored relatively well in Step 2 CK, but not the high scorers with us. So anyway, let's start with the presentation. So how do we want you to use this webinar? We want you to take all the different perspective, and try out things and focus on things that work for you. So there is no single way to succeed in this exam or in any other endeavor. So just keep an open mind, try out different things, and you make your own strategy, and that might lead you to succeed. So why is USMLE Step 2 CK is so important. So one of the obvious thing is like it is the only scored exam apart from step 3 that has like obvious impact on residency match, getting more interviews, getting on the higher encoder list during the match. And other thing our panelists will say regarding their impact on regarding the impact of step 2 on step 3 and step 1. Poorvi?
Yeah. So step 2 CK, I would say now it's a game changer. Initially, I know before 3 years or something, the most important thing, or I would say the filter portion used for a candidate's application would be step 1 score. And I would say that made sense then, that step 1 score really talks about your medical school knowledge, your foundational basis. But since it has been changed, I think now the whole importance has fallen upon the shoulders of step 2 CK score. Again, why this change made? Because it is not necessary that if you have good foundational knowledge, you'll be able to apply clinically. Step 2 CK is a very good amalgamation of both. If you have good foundational knowledge, you'll be able to diagnose the person well. And if you're able to diagnose the person well, you'll be able to treat well. So it's a very good comprehensive assessment of a physician, of a person who's transitioning from medical school to becoming a physician. And trust me, if you're doing very good on step 2 CK, step 3 preparation will be just like a cakewalk. And as we all know, step 3 preparation, everybody's distressed during the time, because it's the time of application. We do not have time to study. We are in the interview phase versus applying phase. So step 3 is everybody's distress period. And if it can be really cakewalk and comfortable time if you have good step 2 CK foundation or score. uh, I would say, again, there is a reason why we give step 1 after then step 2 CK and then step 3. So if you ask me about step 1 preparation, I think it should go in order, about, because step 1 really builds the foundation of your biochemistry, of your basic sciences, which has to be applied in clinical sense. So I would say this webinar, though it might sound long later on, 2 hours versus not, but uh, if we can call it game changer, like it is the game changer in today's residency match and for the years upcoming.
Thank you, Poorvi. Let's move on to how to score high in step 2 CK. So let's talk about the general study strategy. Devam will guide us.
Hello. So the general strategy which like most people tend to use, you cannot ignore initially, is your step 1. As ironic as it sounds, the pass or fail, and yes, you should try to give it sooner than compared to the previous years, give it a few months, but you have to prepare well. Like Puri just mentioned, it is a very foundational basis to your scores. You can only think of a diagnosis or a treatment or further management once your concepts are clear about the disease. You cannot treat a problem without knowing the problem in the first place. And that basis comes from your step 1. As for the resources I had, which so most people use UWorld is the main resource. Everyone uses UWorld, and there are two ways you can approach it. You make your own notes out of it, or there are some notes which have been pre-made. They're not the best because they won't be in the flow which you like, the sequence which you like, and you have to work around it. But if you're pressed for time, like I used them, and then I have to index the entire notes, and then I had to add on notes as I went by. But the main thing is UWorld. That is, and you cannot slack off on it. You have to give yourself time, take your preparation. That is the main resource. Now, if you had a big gap between step 1 and step 2, then you want to brush up on step 1 as well. So I had revised my first aid and pathoma, but if you had a very short gap, like a few months turnover, then you don't need to do that. You can directly start your step 2 preparation. the one goal you should keep in mind when you're preparing any notes or preparation, a single final notes for you to approach the exam. When you're in the last 1 or 2 months phase, you don't want to go through multiple books. It has to be everything in one place. And it has to be cohesive. Like if you're reading it after a few months, it should still make sense. It should not be just bullet points which make no sense with no context later on. So keep that in mind. It should make sense. And the last step, of course, is the mock assessments. Once you are pretty thorough with your preparation, the only way you can assess how well you're doing and how you're prepared is your assessments. That is the overall like broad view of like the shallow view, I would say, of what resources you can use for step.
All right. Thank you, Mati. Sorry, Devam. So I think you talked about this in detail. Like it's like we already had a general guide regarding how to make a strategy regarding the step 2 study. As Deva mentioned, if you are weak or weak with primary knowledge base, or if you are far out from the step 1, start learning from some primary knowledge resource. There are so many boards and beyonds. You can refer to your own previous FA, Pathoma. Practice and learn from UWorld question bank. Make a final revision material in parallel while you are practicing or learning from UWorld. Take assessment, learn from it, and take the exam. So this is like broad overview of things. You can make your own strategy around it. Timeline. So yeah, Devam.
So I gave my step 1 quite a long time gap after my step 2. I mean step 2 after my step 1. I had some issues going on, so I took almost 5-6 month gap. But since I had already more or less understood how my studying strategy works, so initially you start off. I reached out to my friends and I figured out finalized my studying strategy, and I started in January around mid-Jan, and I gave the exam by the first week of July. So overall, it took me, I would say, 5.5 to 6 months. Of that timeline, I took around 1.5 to 2 months for my final pass. And before that was just making my notes, covering my foundation, making sure before my final revision, I'm ready for that. And the final pass segment, I was revising whatever notes I had made, trying to improve on topics which were still lacking, and doing all my mocks. So this is the timeline I worked.
I want to add something. The usual said timeline is like 6 to 8 months sometimes. But what I have realized, if you extend it more than 9 months, you actually start declining, because there is a certain period after which your past memory, knowledge, whatever, you'll not be able to integrate that much. So even if you think that you're not doing well, there are ways to improve upon, rather than just extending or keeping on extending time, because after 9 months or so you'll actually start declining in from your prior performance as well.
Yes, I think I would totally agree with both of them in terms of the timeline. I would tell you just my personal story that when I took my step 1 exam in 4th year, then I had to take my medical school exam. And after I did my medical school exam, this was like, I think I took my step 1 somewhere October 2019. And after that, I did my medical school exam. And then it took 3-4 months. So by January 2020, I was kind of thinking about starting preparation, but I had like finally a very busy schedule. We had to go to wards and all those. So didn't really find time, but then there was the pandemic came. So that was the time where I thought I need to effectively use the time. I went home and I think in March, everything was like shut down, and that was the time I made plan that I need to take my exam in 6 to 7 months. And then I started preparing for it, and I took my CK in October 2020. So I think 6 to 9 months is an ideal time for step 2 CK, as mentioned by the other panelists, because the longer you take is as a human being, you are never satisfied with your preparation. And I think if you ask somebody who has scored 280 and if you ask somebody who has scored 240, both of them If you ask them one day before exam, they would say, no, I'm not ready. No one is actually ready. You cannot get to that point where you are certainly sure that this is the day where I have to take exam. So so how would you know that it's the time to take exam? The first thing is whenever you start study, that's at least my strategy. I give myself a time frame. Okay, 6 months I'm going to be, by the end of 6 months, I'm going to get into the exam, right? So with that, you pace your study, your timeline, you do everything in a way that you have that end point in mind where you are going to stop. So this you may for with some people it is not exactly the same. Some people may have some problems in the middle. So you can delay by a month or two according to the problems or the situation that you are facing. But I think the ideal timeline would be between 6 to 9 months. And I think if you do the resources, for example, the main resource is UWorld. If you do UWorld once and then you do it twice, you cannot learn new things. You would be rather cramming things, and you will be like you will try you will be getting the U-word questions right because you are remembering them, but that's not going to add any improvement to your knowledge. So the best thing is just to do the prerequisite, do your assessment, do your reward exam, and in whatever you are weak, you just study them, fix a date for your exam, and then just go and take exam. Remember, I was the most scared person when I was going to my exam. Like I would say I thought maybe because I was all my seniors and the university at that time, because I was a fourth year student, never came into final year, never touched medicine, never touched surgery, never touched any pediatrics. Everybody was talking to me, hey, are you crazy? You are doing it now. You may mess up things. You have done well on step one. Just wait, finish your final year, and after that, go into your exam. But I said, okay, what are the requirements for step 2 CK? It is UWord. I have done it, and I think I have done well on the UWord percentage wise. I did well on my assessment, and I said and I thought with myself, if I don't take it now, what could be extra that I can do if I am delaying it after my final year exam, or I'm giving it 6 to 7 months more? Then I thought there was nothing I could do. I could improve. Whatever I had to do, I had already done that. And that was when I went to the exam and I did well. And all those who were actually telling me to delay were actually surprised when I received my result. So that's what I'm saying. You will always be scared. You are never human being. As a human being, you can never say, okay, this is my day. I'm going to do it. So when you are done with your prerequisites in your preparation, just go and take your exam.
And you'll always overshoot. Like if you think you're going to take in 4 months, you'll end up giving in 6 months. If you think you're going to give in 6 months, you'll always end up being 7th or 8th month. So always give a buffer time to yourself. You're a human being. Anybody will require more time versus more often than less time. So plan those 1 or 2 months of buffer period in advance. You will never, as Mati said, you'll never be ready. And for sure you will, and it's legit that you might require 1 more month. 1 more month won't be unreasonable to ask for. So if you are in that cutoff where you need to apply before a certain time frame, before ERA's time frame, if you want to get ECFMG certified, always remember this 1 or 2 months buffer period than you think than you are going to take. So that is also very important, because I thought I'll give in 6 months, but I could not. I took 8 months to actually give. So that buffer period is also very important to keep in mind. But again, the consensus from us is like, do not try to extend it more than 9 months of preparation time.
That I agree with. Like, do not. And also, the other thing I can add a small sub note is your final preparation phase should not exceed 2 months, I feel. Because more than that, then your final preparation starts completely fading out. And second, your burnout. Because your final preparation phase when the intensity is at the max. A normal person cannot do it more than 2 months at the max intensity. So be wary of that. And yeah, like what they said, postpone a little. You are human. We might need to postpone once or twice. But if you're postponing, it has to be under a condition. Do you have something you can do specifically targetedly to improve in that time slot? If not, like I said, he thought that he couldn't improve anything if you gave a data. If you can't, if you think that I don't know what I could do different, you have to do something differently, not the same. Because if you feel you're not ready, clearly what you're doing right now is not working. You have to do something differently and you should know what you're doing. And unless that condition is not there, it doesn't make sense extending and already forgetting stuff you have worked on right now. So be wary of that as well. And yeah, you'll never feel ready. Like both of them treated, you'll never feel ready. I was the most unsure person the day of my exam. And it is normal. So that you have to remember that whenever you get the exam.
All right, thank you. Let's move on to the most critical part of our talk and step to preparation, that is UWorld, how to utilize UWorld effectively. So let's tackle one question, like frequently asked question one by one, online versus offline. I believe there is no debate around it. Like you should always do UWorld online when you are serious about step to CK, because it is always updating, it is always changing. You can get your like direct feedback regarding your progress, regarding your scores, and you can definitely go back to your previous blocks just to see where you did mistakes, where you mark question, which type of question you are getting in wrong. So all of these features will be missing if you do offline version floating around on Telegram or Facebook or Google Drive, and it might be old as well. So it is always like better to do online UWorld. Now let's talk about whether to do subject wise, system wise, or random. So Purvi will start regarding that.
So I'll talk about subject wise first. All right. So step to CK, I'm sure all the participants of today, they must be somewhere in their preparation phase. So as you realize, while going through a question, the question stems are so long. They're so pretty long and so elaborate. A person's presentation, past history, family history, uh, vitals, examination findings, and possible differentials, then diagnostic tests, imaging, like everything is concised in such a big question step. So in your mind, you need to imagine a person that I am the bedside doctor and this is the patient for me. I have seen approaches like people doing just internal medicine questions, just pediatric questions, just OBGY questions, and just surgery questions, as UWorld gives you options. But according to me, the exam is a mixture of all the subjects together. They will not ask you internal medicine in one block and pediatrics in another block and OBGY, female, ladies in third block, right? So you'll get all the mix in one particular block. And that is true for all the blocks. It is very difficult for a human being to switch from an adult patient versus pediatric patient if you have not trained yourself to do so. What you practice in those 6 to 9 months of preparation is what you are going to do in your exam. If your brain is trained for looking for adult patients all the time in one particular time frame, it will be a disastrous step to switch from an adult patient, imagining adult patient, to imagining a pediatric patient versus imagining a OB patient. So I would definitely never recommend to do internal medicine subject wise, like segregating subject wise. I would definitely recommend doing a particular system wise and combining all sorts of and all ages of patients. Uh, because again, it is what you train your brain to be is what you're going to perform in your exam day. So just imagine that you're practicing all the 6 to 9 months that you're taking for your preparation is your practice for your exam. So practice all the sorts of patients, all age groups of patients that you are going to encounter in your exam, is my opinion. My fellow colleagues can also comment upon the same.
So basically, subject-wise is a big no-no. The systemic makes sense to build up a knowledge regarding a particular system. But what about random? What what are your opinions on that, Devam? And yeah.
I feel initially if you should start with system wise, because random is good, yet the exam will be random. But if it's completely random and you don't have the knowledge base in the starting of preparation, you will not correlate. You will see a patient of heart failure. Next thing you see a CNS patient that has no correlation, and you cannot form a core understanding, I would say, or a chain of thoughts to understand one process completely in itself or one system. So system wise helps initially because you see sometimes seeing multiple questions on the same topic also reinforces That's his topic, makes you see the differences, the 10 different point of view a patient could present, the disease could present, and how that one word or one line could make the difference between that you treating or approaching it a certain way versus a different way. So that way, I would say system-wise for sure. Subject-wise was no, like Poorvi said, there is no question about that. System-wise helps initially, unless you're very confident in your knowledge base and you have given step one recently and you are on a very hard-pressed timeline, like some exam is like you want to apply this your areas, you have 3 months left, then maybe consider random. But other than that, no, do not. That is my opinion.
I would still say first pass should be system based. How much pressed you're upon your time. Like even if to give in your 3 months, do system based for 1 month. Like there is no way we can try to form protocols. In step one, you do not encounter the protocols or the diagnostic flowcharts or the treatment flowcharts that you will very frequently encounter in your step two preparation, right? A particular subject, for example, MI, you will encounter diagnostic chart, you'll like encounter the treatment flow sheet in your step two very often. So to build that foundation, I think even if you're pressed upon time, my opinion would be to still stick to system based, at least in your first pass. The random questions would be like stimulation of your exam and would be like practice based second pass versus third pass if anybody needs.
I think I totally agree with both the panelists regarding the system wise. I have a little bit just different story in terms of the system wise. When I started my first block of step 2 CKU word, so I did all the systems and I did very badly on the first block. This is, I think, I would say the first two blocks of my step 2 CKU word. So when I finished the block and I went to my reviewing the blocks, I found something, and that was that all the questions, or I would say 80 to 90% of the questions that I did wrong were OBS, not gynae, OBS, and it had a reason because step one didn't have any OBS portion, and I never had read any obstetrics before my step 2 CK. So I was like, oh my God, there is this thing that is going to bother me a lot. So what I did, I went to step 2 CK notes, like there was those notes, and then I read those notes. First of all, uh, I improved my obstetrics portion because I had no idea about the charts, 1 minute, the deceleration, acceleration. I only knew it was a car which decelerates and accelerates. So I didn't have any other idea about those. So I improved that portion of my preparation, and after that again I did the whole systemic wise thing, and I think I did improve. So this is a little bit tip if somebody who's coming and doing step 2 CK right after their fourth year medical school and they don't have those they haven't read any ops portion before. So I would suggest you need to do something before you chip into the UWorld. Otherwise you will be very much discouraged. And I think that's the only area which is like not so much present in this step one UWorld, and that is you will struggle on that. But if you improve that, then the rest of the step 2 CK you already have a foundation from the step one, and you will do very well in your step 2 CK UWorld as well.
Okay, Mati. All right. So let's see. So we covered that. So this is an important question, like UWorld for learning versus UWorld for assessment. It is an attitude thing. So let me explain myself. Like when someone is practicing or learning from UWorld for the first time, like what should be the target? Like how should one take the exam scores and feedback from UWorld, as a learning or as assessment? So what are your opinions on that?
I can elaborate my experience once. I think, Arjun, you will also remember. I once called you during my preparation. I scored 11% on a block in psychiatry. 11%. So I was completely blown off by my performance. that gave me an insight into myself that this is not an assessment for the first pass. It just showed me how poor my foundation in psychiatry was. So I very sportingly took it as a learning tool for my first pass. Definitely. And I think I'm not ashamed in accepting that even if you're a physician somewhere, you might be poor in some aspects of your medical knowledge. So there is absolutely no shame in accepting that. Yes, we still learn from UWorld, and definitely, I mean, it is the god, I would say, god of all times and god of all times for step to CK. I have tried so many resources, just laid my hands on briefly on other resources, but it is a very very nice and effective learning tool, though it blows you off for some time, because step one, you are used to so many resources. You have Kaplan, you have videos, you have so many notes, you have first aid, you have like whatever you ask for, you have a resource to build your foundation and then try your hand at UWorld. But no, in step two, you are thrown at, and if you keep that mindset coming from step one, it is not going to work. You definitely for step one, we did look it as an assessment tool as well, because we had completed some of the foundational knowledge, some of the learning from other resources, and then we tried our hand at UWorld. But it is a very different experience for the step 2 CK. You directly are thrown into the question bank, right? So I would say that definitely it is the best learning tool. Of course, it has its own pros and cons. Of course, you feel so much over the place. It is all question based. It is so much over the place. Nobody will teach you this is how you approach. Nobody will uh, talk to you in videos that this is how you navigate your way through the long question stems. But you will learn, we will of course guide you in our further slides, but UWorld does train you to navigate through the stems, through the diagnostic flows. So first pass would definitely be learning tool, and the same set of questions become your assessment tool when you give your second pass, when you revise, when you simulate your exam questions. So that's what I think.
Thank you, Poorvi.
I think my take on whether UWorld is an assessment tool or it is a learning tool. I think in terms of my experience, if you ask me how did you use UWorld, so I think for me it's kind of both an assessment tool and learning tool at the same time. And that would be when I am doing the question before knowing the answer, it is an assessment tool for me. And once I do my question, whether it's wrong or right, after that it becomes a learning tool for me. So on every question, I use it as both resources. For example, especially in the current time when your step one is pass and fail, all these three exams, they are interconnected with each other. So if you have done very well on step one or your preparation is very good, then you are going to do good on your step two CK, and same goes for step three. So if you are not doing very well on your step 2 CK UWorld, it means there is something in your step 1 preparation, because that foundation step 1 tells you based on what you have learned from step 1, you understand the question, and with your new knowledge you are going to solve the question. So that understanding of the question, that comes from your previous knowledge, and if your previous knowledge is not as good, then you will definitely struggle. So for me, if you are doing very, very bad, if you are doing in the middle, that's fine. Everybody does it, right? You can improve. But if you are doing very badly on your UWorld, even during the first pass, then you need extra effort than that any every other person, because there may be something that you are missing during your preparation, or you miss during preparation, especially with the current times, and you don't know where you stand between the cohort when you take your step one exam. If I take my step one exam, okay, you are passed. Somebody with 90 percentile is also passed, and someone with 65 is also passed. So you don't know where you lie in that spectrum. And I think once you start the step two CK UWorld, your performance there is going to tell you where you stand. But still, if you don't get good percentage, that's not something that you should discourage. Then you need to do more on the learning part. For example, if you are not, I am doing a question, I read a question, I do it right, it means I have studied well previously, but still you are going to go through the whole answer, and once you are done, your answer is there. It is your learning tool. Learn each and everything, not that you just did a question and it's right and you just ignore it. No, it is, as I said before, my answer, whether I get it wrong or right, it's my assessment tool. But when I get my answer, then it becomes my learning tool, and I give ample time to every option and everything and try to read that. So try to use it as both tools. In my experience, it is going to help you, and that is what has helped me. Maybe you can use your way, but if you ask me what did you do, this is how I approach my UWorld both. And the second pass, that is definitely an assessment tool, but even the first pass, I try to use it as a both assessment and learning tool.
Hello. So I agree with Mati very similarly on this aspect. So for me, I used to actually read the notes before I would do my UWorld, along with my step one revision because there's a long gap. And I always had this approach that if I am solving UWorld, I should know the facts at least. Not everything, not the question, but the facts. Like there are topics, suppose you get a question of MI. What you give for treatment is a fact. Now, out of 4 options, what to choose, that is your concept. But I always wanted to know the facts before I solve anything. So I wouldn't go blind into my UWorld. I didn't like it. I didn't enjoy it. I tried it a few blocks. It was confusing. And I felt like I don't know if I'm conceptually getting something wrong or I'm getting something wrong factually. So I would read my notes usually, the notes I had, so printed once, and then I would solve it. And for me, UWorld was 80-20. It was 80% still learning because there'll still be a lot of things which is not covered in the notes, and I'm always going to be lookout for them. But like you said, while solving, it is an assessment. I have a topic, I have a prior knowledge base from my step one and from what I read. Have I applied it well, or what has happened there? And once the block is over, I used to always do time more. So I would not stop after every question, not stop at the end of a block. And then it would be purely a learning. Then I'm not going to bother, oh, I scored so poorly. I'm not going to sit and brood over it because that is not going to help. You're learning still, you're in the early phase, you have to improve. The target is you made a mistake, it should not be repeated if possible. So then I would look at why I made the mistake, what I could do to prevent making that mistake. Was it a factual error which I need to learn more? Is it a conceptual error that I'm missing something in the disease that I have to focus on? Basically, look at what is missing out in your prep or your basic structure in your knowledge, and UWorld is supposed to do that, fill in those gaps. And like they said, in your second pass, it is purely an assessment. Then there is no question. And there'll still be some learning there. There'll be a few topics newly added, so that is still learning. But 90% of it is going to be an assessment. That is how I approach my UWorld.
So thank you, everyone. Yeah, so to summarize, UL is mainly for learning, especially when you're doing the first pass, but it also has a component of assessment. But how you take it is up to you. I would say take it in a constructive learning mindset. Even if you're getting a low score, just take it as a feedback. Do not take it personally or like emotionally. Okay, why I'm getting all the incorrect? What I know it is very hard for even me, even for me as well. But always. Like focus on how I can how I can improve and how I can avoid making same mistake over and over and again, as like Devam said. So all right. And last question: how thoroughly UWorld is to be learned from or done?
I can take this. So again, what I realized of course, I gave my exam in same time frame as Mati, October 2020. But while giving the exam, one thought was in the back of the mind: it is all UWorld. Even the exam it's similar to UWorld. Of course, they're not same questions. The concepts are the same. So I would say UWorld learning assessment as well as it is a practice tool for your exam. So it has to be as thorough as you can be. Everybody has a different threshold and a different recipient reception quantity, quality, but as thorough as you can be. If you think that doing 2 passes, 3 passes is good enough for you, it is good. If you think you still need extra help from outside, from other resources, then that should work. So everybody will have a different recipe of the same dish that has to be made, but your ultimate goal is your scores, right? So again, if we can combine these two questions, how thoroughly it has to be done from and how many times it has to be done, I think the answer will be similar. For example, only 2 passes might work for me versus 3 passes would work better for somebody else. So I would say after my first pass, I could ask myself a particular question, which I did: how thorough I think I am in my preparation. I can divide myself or divide a particular preparation in 2 parts. I would say that, okay, uh, I am good in my foundational knowledge, and second pass, third pass has to be just practice based. Versus, I think I am not very good in my foundation yet. I need to fill in my gaps, and then I will do my third pass, second pass, third pass based on my additional input. So I would say that everybody will have a different approach, different recipe, and different methods of learning from the same question bank. But you need to ask yourself very much this question that I'm posing upon: how good you think in your foundation, because there is no question bank that will be repeated. Everybody will get different questions. You will not be able to cram questions and just vomit it out in the exam. Ask yourself after the first pass how good you are, how good you think you are, and then take from there, I guess.
I
Okay.
agree with most of what Poorvi said, but one thing is you have to be aware of one other thing. Fine, you might feel like you want to do UWorld 3 times, but midway through the second time, you will sort of start remembering the questions. It is human nature. We see a question, you remember some aspect of it. So be wary on the third time, the questions will feel like you already know the answer by default, not because you definitely understood the concept, but by looking at the question, you will know this was the question, this is the answer. So if you feel you might need a third time, a second and third time because your foundation was weak, maybe supplement it with a different question bank or different resource in between, and try to limit it to the second pass of UWorld because that is where it's most potent at. The third pass is always the risk of you remembering the questions rather than how to put actually using it for understanding or assessing yourself. So that is one thing you have to be mindful of. And as for how thorough, like she said, each more so the review than the question, the reviewing, because you are just learning initially. You have to be very thorough in the explanations because everything you need to know, almost 80% of it is there in UWorld. And if you're thorough with it, you can understand how to, like, you can understand the disease properly. And if you throw with the question as well, you learn how to approach a question because there's a very targeted approach to how you approach a question. So you have to keep these points in mind. Be thorough with it. There is no compromise on that.
Yes, I think I agree with both the panelists. It's not like I have seen certain approaches that people use. That some people say, okay, just read the educational objective of the question or learn the educational objective. But I think that's not a very good idea to do because uh, the UWorld explanation has a lot of things that you need to know. For me, it was I would read each and every option unless I have covered an option before. I think at least one sentence or some maybe few words notes I used to take from at least all the even for the options that were not the correct ones, I would at least take some notes, maybe 2 words, 3 words, as I mentioned earlier, unless I had covered that point in some other question and I've already taken notes for that. So be as thorough as you can. At the more you know, the more it's better for you during your exam because you don't know specifically which area are you going to, which question are you going to get. Maybe the same topic, the topic on which the question is based, that is one aspect. But if you learn the explanation and you know everything in detail, then you may be able to pick that question when it is asked from a different aspect. So when you solve one question, you know one of its aspect. But if you read the explanation and learn it thoroughly, also learn why other questions are wrong, then you know if that question is asked from a different perspective or a different aspect, you would be easily able to answer that question. So my suggestion is do it very thoroughly, learn as much as you can from every question.
Good summary, Mati. So now let's move on to more granular stuff. How exactly UL can be done in the best way possible? How exactly solve and to review UL questions. By solving, I mean like when you are taking the exam and you just try to get a correct answer possible. And review is like how you learn after answering the question from whether it can be correct or incorrect, but like how to exactly learn and like increase your knowledge. So Devam will be covering it. Devan.
This is initially, this is the question you see. Ignore the option I have marked right now, but this is the question you initially get. My initial approach would be, I would start with the last line. Why? Sometimes you read 4 or 5 lines of the question, and in your head you're trying to diagnose, but the last line often tells you this is a diagnosis, and you manage it. So you will save time if you look at what targetedly you're looking for. So could you go to the next slide? So this is like, now during my reading, after I've read the last line, now I am reading the question from top to bottom. And I go on and highlight points which seem relevant. Relevant as in, it's going to help me arrive at a diagnosis and also a management. So here, a few words I would have highlighted. He's an emergency patient. So I know he's emergency, not ambulatory. Ambulatory is a non-serious patient. Now there is sudden answer. So that is one point, acute. Second is he has numbness. I'll come back to why it's important later on, but I have marked it is something not normal, numbness. Now there's a negative history, no history of trauma, fever, or chills. Again, I will come back to why each of them are significant once I have gone to the review section. But the no history of trauma, fever, chills often rules out infections or an inflammatory disorder systemic. Now he has had acute MI. He has leg pain and he has an acute MI with cardiogenic shock. This sort of hints at his heart is weak. If your heart is weak, you might have had an aneurysm, and that leads to a thrombus formation. So that could be one of the reasons. So I've highlighted. I don't know for sure, but I've highlighted that point because it's different. Next, he has normal vitals, so I am not bothering to highlight that. Now, there's an important physical symptom. He is pale and there's coolness stress. So I've highlighted that because there's a difference between the right and left leg. And the pulse is important, so helps me localize it. In the right leg, which part? Popliteal is good, so above the knee is usually normal. It is more towards the distal segment, so it's the foot. And then there's again numbness, and more specifically, I've mentioned here is loss of sensation with weakness. So there's some neuromuscular component as well. Once I've gone through all these DD, I'm trying to form a diagnosis in my head. I know there is some degree of blockage in the blood vessel because there's no pulse. I know that blockage is leading to loss of sensation and also severe pain. Now, from the options, I went with arterial embolism, but I don't directly choose it. I actually, how to put it, go through the other options and deduce why they are not the right ones. It cannot be a thrombosis because usually patients have a history of some atherosclerosis or peripheral artery disease. This patient has none. He was a normal patient till he suddenly developed pain. It could be vasculitis, but he has no systemic symptoms like no fever, no trauma. He has no other systemic signs and symptoms of inflammatory disorder or vasculitis, like purpura, lung, like cough, hemoptysis, none of those. So again, that is ruled out. It cannot be a cerebral ischemia, that is stroke, because there is loss of pulse. A neurological problem will not have a physical problem. It cannot be nerve compression because there's loss of pulse. And venous thrombosis is a potential DD, but venous thrombosis is never this acute. It is usually dull in presentation. So now I have marked my answer. This is how I approach the question. And I got it correct in this one. So I'll now go to the explanation segment. In the explanation segment, my initial goal is read everything. And as I'm reading, I am comparing, I'm either highlighting stuff which I'm going to add to my notes. So initially, the table is a very comprehensive table, gives me the common etiology of acute limb ischemia, the clinical features, and the management. It's a very brief overview, so I'll keep that as the initial segment. And then I start reading. Now, I have highlighted, let me see. So the first paragraph is more or less a table, the 3 most common causes of acute limb ischemia. Now, this question, like I read from the question, it seemed like a cardiac case. How do I know it was a cardiac case? It's because the sudden, so it is acute. Patient was asymptomatic, like I mentioned previously, so it usually rules out peripheral disease. Peripheral disease, I mean atherosclerosis. That is the second most common cause. And there was no trauma, as in he didn't have an injury, he didn't have any stab wound, he didn't fall, none of those. So all of these positive and negative findings are more or less hinting towards your embolus. But you're highlighting each of these because when you're making your notes, you want to be, these are all your DDs for the disease. This is a typical presentation and how you differentiate the causes. Then the next paragraph is more or less factual segment. If it's cardiac, what are the common causes? Afibrillation, aneurysm, that is in this case, infective endocarditis, or prosthetic valve thrombosis. So in each case, you are here they're asking that question. In some cases, they'll ask you, what is the common reason for this emboli to occur? So these are factual knowledge you want to put down. Then one. Now, the remaining I've highlighted is since it's an aneurysm, why an aneurysm caused the embolus. So I've highlighted that. If you do not have that knowledge priorly, there's something you will note down in your notes. Now, till here, I've been focusing on the correct, why this was the right answer. Now, while I was telling you my differential in the question, I already mentioned the subsequent points, why the other options were not correct. These are important because, again, these are differentials which you'll have to consider when you're solving questions. It is not peripheral arterial disease, like I mentioned before, because patient had no prior history of smoking or atherosclerosis. It is not vasculitis because there were no constitutional symptoms. There was no systemic findings. And the other points I've already mentioned in the while I was deducing the correct answer. The whole overall view is you highlight only those things which help your understanding, which add facts to your knowledge missing. And then once I've highlighted them, you note them down somewhere in a more structured manner. That's how I'd review the right question. On the next example, I'm going to show is a wrong question, how I approached it. I'll go to the next slide. Next slide, Arjun. So again, I read the question, start with the last slide. I have highlighted stuff that stood out to me. Left leg pain, localizing it to the left leg. Then, next slide. Now, now here's the difference from the previous question. It's the same topic, it's acute limb ischemia itself, but patient had pain in both legs. What does this tell us? He has a peripheral arterial disease. Is that why the left leg pain occurred right now? We don't know yet, but it is a pointer history to consider. Now, he has severe left leg pain which started resting. This tells us it occurred abruptly without any trauma or any other symptom. He has numbness, similar things. Then now he had intermittent palpitations. Now, if you remember from the previous question, this is again a key point. Why? This hints at what could have caused the disease. One of them was palpitations. Palpitations, that is afibrillation. The next point is he smokes cigarettes daily. This hints at it could be the cause of the blockage could be atherosclerosis plaque because cigarettes associated with peripheral arterial disease that can cause an atherosclerotic plaque. Now, the third point is with palpitations, it's irregular. So we are closely hinting at afibrillation right now. Then air is sparse on both legs, distal pulses diminished. These are common findings which you see in acute limb ischemia. I highlight them because when I'm solving a question, I'm looking at these. And usually that is the main focus, to find out the disease first and then the etiology of what the disease was caused. Sensations decreased, weakness, that's usual stuff in last question. Now, in the options here, I got it wrong, like you can see. I went with acute brachial index. Why? The usual step in limb ischemiasis is the first step. If you're suspecting patient had a blockage, you go with ankle brachial index. But the key point here was the patient was an acute patient. He didn't come in with suspected case. We knew by his presentation and his symptoms that there is a blockage. There is a suspicion here. So here the approach changes. Here you have to directly go with the treatment because the first goal is to make sure the disease doesn't worsen. And then you can go with the other options, which I'll show in the review, of why you choose other options or don't choose other options. So that is, you have to consider a non-emergency patient and emergency patient both have different approaches. That's the one point I missed out here. So it's like you could see how I got all my points right, but one word I missed has caused me to get an error on this question. So you cannot slack off while reading the question either. Everything could be a potential positive or negative differential. Now we go to the explanation segment. Explanation, the first paragraph is more or less same. It talks about the disease, the general consensus of the disease. Then he talks about the classic presentation. The first highlight you will see it mentions is this was because of afibrillation. I had gotten that right anyway. But it could also be because of a thrombus plague. They did not give me specifically something different. The patient had afibrillation and he had a history of thrombus. So I don't know what has gone wrong. It could be the embolism or it could be the thrombus. And why I mark this as crucial is initially I'll give the patient heparin. He is an acute patient, he needs heparin for treatment. But then when you're going to treat it, you have to know what caused it. If it was in the heart, you will go with a scan to look at the heart, look at the clot and remove that clot along with the clot in your leg. But if it's purely a thrombotic plaque, then once you remove the clot in the vessel in your leg, you cannot really do anything other than go for a different treatment procedure. That is why the etiology is important in this case, and I've highlighted separately. Now, as I said, you start with heparin because that's important. And I wrote down the reason why it's important. So I have context of why in this case I'm going with the treatment first and not the test. Since the question was wrong, and my first doubt was ankle brachial index. So now I'm thoroughly reading that paragraph and highlighting as to why not that test first. So, like I said, that test is for confirming a suspected case. It is not for, like, once you know it is a suspected case, like once you know it is directly a clot in clinically, you will not go for a test to check if it's suspected. You will directly go for treatment because it's an acute case. So I have marked. It is checked for suspected PAD, and you do the echo only much later on to look for an embolus. Here, the etiology was important. But why I have not done this case, I have marked that highlight as well. It should only be performed after his acute limb ischemia treatment has been treated. Like you give heparin, then you can decide, do I want to do a scan first or do I want to do a surgery first? Or do I want to proceed with thrombolysis? And again, with the rest of the options, similar approach. Why not that option? And after you've read the entire comprehensive, you form a chain of treatment. Like in a normal case, you will go with ankle brachial index. In a emergency case, you go with heparin. And then what sequence do you follow? Based on the etiology. If you think it's the embolus, you want to go with checking the heart. But if it's not an embolus, then you will directly do a Doppler or some other scan locally. And if it's very severe, you will want to immediately remove the clot after heparin. If it's not as serious, you can take your time to do more tests. The whole goal is you look at why that diagnosis or treatment and why not something else when you're reviewing your questions. So, yeah.
I had a very slightly different approach, which I wanted to show to people who have less time because I always had less time. Arjun, can we go back to first example? Okay, so I, as a person, while solving questions, I always imagine myself to be the doctor given in the situation. If it's ED, I imagine myself as the ED doctor and I imagine the patient. I had the habit of reading first line, last line, options, and then go back. So I quickly imagine of an old man coming with leg pain, numb. Then the last line tells me whether I have to diagnose this patient or I have to treat this patient. So I would focus, okay, I just have to diagnose. So it asks about cause. Okay, I have to diagnose a man with limb pain with following options. So while reading the questions, I ask myself, like, it's a limb pain. What are the possibilities? Bone, muscle, artery, vein, or nerve? While going through the question stem, it tells me it's not bone, it's not muscle, it is artery because you cannot feel the pulse. And if it is artery that you're not able to feel the pulse, what are you going to do next? I am going to feel the pulses. I'm not able to feel the pulses and the sensations are poor and it is acute. You have a history of heart attack before. I have localized myself to artery, like bone, muscle, artery, vein, and nerves. I've localized myself that pain, that it is arterial pain. From that artery, it could either be thrombosis, it could either be embolus, as simple as that. And because it is acute, because we have a condition predisposing to it, that was heart attack, it is probably embolism. And then I will confirm, okay, not thrombosis, acute, not vasculitis, no, the history doesn't suggest. Cerebral ischemia doesn't support anything. Nerve compression, when I was reading the question, I had already read the options before. So I know, again, not nerve compression because there is no radiation, blah, blah, blah. Venus, no, doesn't sound logical because you cannot feel the arterial pulse. So I would approach a system based approach based on the presentation. I always talk to myself, okay, so this is a limb pain. The approaches to the limb pain would be different based on ER versus your non-acute presentation, like Devam was telling us, diagnosis versus suspected case, ER versus OPD patient. So I have a very presentation based approach, which I used to follow in the order, just to concise again. First line, talking about chest pain versus limb pain versus uh, respiratory distress. Going to last line, what are they asking? Are they asking me to diagnose? Are they asking me to treat? Quickly scanning through the options so that when I go back to my question stem, which are double this size, trust me, they will be longer than this in the exam. So you need to keep those options in mind so that you start ruling out them while you are reading the question itself. So as simple as that, I would keep to myself. I would imagine the leg and then rule out bone, muscle, artery, vein, nerve while I would read the question, and that would be my differential as well. So I don't have to read the question all over again and again just to rule out the other options.
I think both of the panelists, they described everything in detail. I would just give a quick summary of what I think of a question. So my approach is kind of similar to Poorvi. Whenever I see a question, the first thing is I read the last line and see the options. That helps me because I know that there is something going on with embolism or something with blockage. So in a fraction of seconds, when you have so much knowledge back in your mind, all your knowledge is focused on a particular topic on a particular patient. So while I'm reading the question, my mind is trying to work out on the options. What could be the possibilities? I have seen these 6, 7, and then your whole knowledge about these 6, 7 options is like focus. It's like there is a lot of knowledge, but your mind starts hitting the point which is about which the question is. So for me, I usually highlight the first line as a whole because that is usually the presentation, and then I would do a checklist. Okay, the first checklist is subjective. What is the patient feeling? And then there is objective thing. What is a doctor you see on the examination? And then is there anything in the past medical history? So these are the three things that I look in the question. For example, I look at this question, somebody who's coming with severe leg pain, and that is about an hour ago. Timing is extremely important in every question. And especially if you go for, this is a different question, but if you go for other questions, psychiatry and those time is a major thing. I would not go into that detail, but always remember the time. Is it 1 hour? Is it 2 hours? Is it 2 days? Is it 10 days? Is it 100 days? So timing is something you really should focus on every question. Then I would go, okay, is there any past history? Yes, he recently had a myocardial infarction. So that is my past medical history checklist. And then there was a presentation checklist. Then I go towards the examination. The examination is, okay, popliteal pulse is normal, and then more distal pulses are not palpable. So that is my examination, neurologic exam, everything, rest of the thing is normal. So I would actually check mark my these three options: subjective findings, objective findings, anything in the past medical history. So sometimes you may rule out some of the options based on these information that you get from the question. But when you are confused between two options, then what happens? Then you see, okay, for example, if I see, just imagine, if I say, okay, it's arterial embolism, I have ruled out everything. It's arterial embolism, it's arterial thrombosis, and it's arterial vasculitis. So then there would be some negative stuff in the question, some negative history and the question stem, that would actually tell you, hey, you are not supposed to pick this question. For example, this, if he is telling me no trauma, no fever, no chills, these things are in the question for a reason. They don't want you to pick compression. They don't want you to pick anything with vasculitis, which would bring fever to us. So I would use my approach and then see if there are some negatives in the question that can help me to rule out an option. That is what I usually myself approach a question. And then when it comes to explanation, can you, Arjun, go to the other slide with explanation? The other ones, with the notes. Okay. So whenever we talk about UWorld as an assessment tool and as a learning tool. So I think this question is a perfect example of how I would use this question. So the first part is done. I did it in my assessment, whether I got it wrong or right. The next question is a learning tool. So this question does not only mean that you need to pick up acute limb ischemia correctly next time when it appears in a question, but this also means you have to correctly figure out the other 5 options if you are going to get this in a question, because UWorld is not going to give you question on each and every option. So to cover those 5 things in the questions, to cover those 5 other topics in the same question, that is where we called it as a learning tool. And that is where UWorld plays a role as a learning tool. So you have to thoroughly read each and every option and learn from the option and try to find the differences. Okay, if it was peripheral arterial disease, what would it be? As it is discussed, maybe somebody is a pre-existing PAD, somebody has claudications. Okay, if these are the options, and the question pops up, then I would go with this option. Vasculitis. Okay, how would a vasculitis present? How would a cerebral ischemia present? So that is when it comes as a learning tool. So you have to not only understand what the question is about, but you also have to learn the not wrong, the not correct options. And next time, if you get a question on that topic, then you are supposed to correct it because they've already read it once in a different question. So that would be my option. That would be my approach to a question when I do it.
Excellent summary, Mati. And I would like to, first of all, I would like to summarize all of the panelists' opinion. So the main thing is there are 2 ways to go about it. But when you start reading question, read the last line. So make up your mind what they are asking about. And in Purvi's approach, you can see the setup as well. Like, is it emergency? Is it like normal outpatient clinic? Is there any like urgency, or is it a chronic disease? And then you go through all the options given, so you can prime up your mind, like focus your knowledge on the like in which differential diagnosis we are playing in. And then we go through all question to either rule in or rule out all option. And that is the one way to do it. And what was the yeah, and for Devam's way it is almost similar, but he doesn't go through the option like he likes to go through each sentence and either rule in or rule out something based on his perception at the time. But I think most important thing is like when you saw after solving, when you review it, when you learn from it, you have to know first why the particular answer was correct. Second, why other options were incorrect. You have to know the reasons as well, because as Mati said, the UL is not going to make question on each single topic. You have to be clear about like why other options are incorrect as well. And what else I can learn from this? As they were mentioned, like, is there any table? Is there any like further management steps they have mentioned? Is there any complications they have mentioned? So what else I can learn from this explanation? So UL explanation, like not only they don't teach only one thing, they teach multiple things, and they teach us how to differentiate with close differential diagnosis as well. Apart from this, I would like to pinpoint point out a common thing during the all steps exam 1, 2, and 3. If we ignore social science and abstract and like biostatistic part, usually question has 2 parts. First part is always about pattern recognition, or in other words, diagnosing a patient. And second part can be the last ultimate question. For step 1, it might be about like some histological findings, some pathological findings, some drug mechanism, some drug side effect. For step 2, it can be about a complication, it can be about a risk factor, it can be about a like management step, and management steps can be 5. So you have to decide on which sequence you are. Like, are you on second management step or third one? And then they are asking the next best management step. The point is, you always have to diagnose a patient in a clinical question, whether or not, irrespective of ultimate question, it can be something else, but almost all question is about diagnosis. So to like highlight this, let's go to the incorrect one. So if you read the last line over here, last line is, which of the following is best first step step in management of this patient. So ultimately, it is about a management quest. But if you are not able to figure out that it is an acutely mainstreamia, and suppose you made up your mind about the diagnosis that it is let's say chronic peripheral artery disease. So if you make a diagnosis of peripheral artery disease, then you will definitely choose ankle brachial index, and your answer will be incorrect. So even for management question, it is really important to diagnose the patient first. So if you make a correct diagnosis, it is an emergency, it is acutely ischemia, you definitely go for treatment first to save patient's limb, and then you will derive like come to the correct answer of intravenous hyperinfusion. So always make sure, even while you learn, while you do assessment, while you do UWorld, when you are learning, always make sure that you got the diagnosis correct. That will like clear out half of your like, it will improve your score tremendously.
And remember, most of the times when they ask first step in the management, all the options are correct. If you look at this particular question, all answers are correct. They ask you first step, so that will be decided which setting you are in. You are in emergency department, so imagine that the patient is acute and you need to act right now. So that's why this answer is correct. Ankle brachial index would hold true in outpatient department. In a post-surgical ICU patient, thoracic echo, uh, echo would stand true. So all the options are correct. Whenever they trick you into first step, just go back into what setting you are in.
And one thing I'd add, it's not in this question specifically. An example is, suppose patient comes in with a certain disease and there are 5 sequence of management steps. So they might have done one step already. And then they'll just tell you what is the next best step. Then you cannot, and the option will give you that step oftentimes just to confuse you. You have to be very wary that this is a sequence and this is the next step I want to choose. You cannot again get confused and mess up the sequence. So that is also something you have to be wary of.
All right. So I think that was a great summary of how to solve and how to review questions from viewer. That is the most critical part of whole preparation. So let's move ahead. So yeah, so I think we discussed everything on this slide. As they have mentioned about the hints from the question and how we can apply in deducting or getting the diagnosis. So yeah, but these are other things like not knowledge related part. Then would you like to take it?
So yeah, this is what I did personally. I have heard of most people not liking it. I used to do timed from the first block. And there is a reason for it. People are like, if you do time from day one, how will you don't finish the block? And yes, I would never finish a block in time. But now here's what UWorld has a neat feature. If you do only timed without tutor, you can always just resume the block. It gives the entire full 1 hour. So what I would abuse this feature. Like I would basically only time, not tutor. If you are tutor, you cannot resume the block again. I would do purely time. And just to get used to the pressure of the time. I struggled with it for maybe 1 month, 1.5 months, mainly CVS questions, because CVS questions are very long stems. But once I more or less got the hang of it, I would still end up doing things faster. The reason I stuck with time is why even though the focus is learning and not the time, it helps if for months you have been exposed to the pressure of the clock. It trains you to think faster, find ways to do things faster. That's why I was to do it time. The second point is crucial. Review it the day you solve it. You will not remember the thought process that went into why you chose a certain answer, why not something else, if you review it the next day. I've seen countless people, they will do 3 blocks just for the sake of finishing blocks, but will not review it and piles up the next day and becomes the other next day. Another friend of like a few juniors I've heard, they have 10 pending blocks to review. So do not end up in this mess. Then there's no point when you're reviewing that late. You do not know what went through your head. It's like reading a text and no longer about reviewing a block. And last point mentioned repeatedly, annotate everything into one base material, whichever you're using, flashcards or into your notes, into your first aid, whatever you're using. They are the few key things to use.
All right. Just a minute. Okay, thank you, Devam. So let's move on to very frequently asked questions like how to take notes. Because I personally felt it like it takes a lot of time if you are like obsessive compulsive like me. And then what is the middle ground? If you take a very short note, very like a superficial note, then it would be very tough to revise if you forget something and then you want to go back to a single source containing all the information. So it is a very customized or like personalized thing to find a middle ground, what works for you. It definitely depends on your already established knowledge base. If it is very vast, then obviously you have to take very less notes. But if you're a struggler like me, then you have to kind of make full note like containing everything. But let's see how all of the panelists take notes. So let's start with yeah, and this is the important thing. What's the point of note? Note should be like they should be your final revision material. So don't do random things. Okay, always keep the time duration required to revise as well. Like with like you cannot revise a system for like which is a note for 250 pages. I had that note for gastroenterology in step 1. It has 250 pages. I never got to revise anything. It was excellent, I would say. It was very beautiful. If I saw you will, oh, this is great. I would never recommend anyone to do that. So don't make 250 pages note for a single system. Maybe for all of the material it is okay, but let's hear other panelists' views. So let's start with Devam. This is Devam's notes.
So for me, I started the base ready-made notes which they have for you all, which some senior of ours has done, thanks to them. Now, my target was this. First, the notes were not to my preference, as in the flow of points, and they were very vast, irrelevant points which didn't need to be read again and again. First example here, arterial occlusion occurs due to emboli, thrombus, trauma. I know that. There's no point reading it when I'm revising. So what I would do is, when I'm initially reading, I'd highlight, underline points which I want to take a look at, like the ink coloring you'll see. Blue was my first read. So I know I'm looking at stem I because it's a different case here. I'm looking at the 6Ps because that is the presentation. Now, the next is green. Why I've added the green is that is stuff I've annotated from UWorld because I felt that was missing from these and they added to my understanding and explanation. That is the second step I did. And the last step you'll see in this page, like you see those orange arrows which I've added, and next page I'll put it through.
Okay. Yeah.
Even in this page, you'll see the orange arrows. So my orange arrows were step 2, as I mentioned, is he mentioned it's diagnosis followed by treatment. Treatment is a heavy focus because everyone knows the 5 things needed for a treatment. What sequence? So I would specifically highlight the treatment in orange. Why? When I'm doing a quick revision, I want to specifically look at treatment because that's the thing I don't remember usually. The other things I would often know, and I would only read them if I have to understand the topic. The green and blue, they were important points in presentation, but I would often know them. So when revising, I would not read them necessarily every single time. The orange, I would, because that tells me the treatment and why, in what sequence to go about the treatment. So here is the first page is, it's differentiating the 3 types of limb. Viable limb is basically your person comes with minimal pain, and that is your outpatient case. The other 2 are your acute limb ischemia, which are in the emergency department, which need urgent treatment. And okay, next page. Here you see the 3 stars I've highlighted. They are highlighted different aspects of it. The first one is, yes, acute limb ischemia with threatened acute limb ischemia. So here I give heparin, which is the main first line, and then I either treat it by surgery or catheter. How do I decide which one to approach it with is the third point. Catheter based, if it's still viable and patient is not in severe, doesn't have a very severe presentation, but surgery if it's acutely severe and you lose the limbs. So these orange points is to help me clearly focus and look at what I'm looking at and targetedly decide and help my decision making. Why this decision over others. So I would summarize my notes like that. Use different colors. So when I'm revising, I would not read the entire page. I would only look at these points. And even those I look at often the box segments because those are like the direct fact, like anticoagulation for acute limb ischemia. Why did I read the remaining segment? If I don't need the why, I know the why, I would not read it. It was a little chaotic, but since with the colors, I would highlight separate.
So yeah, so I would like to add like these are like preformed UWorld notes floating around on internet, but this strategy can be applied to any base material. Like you can highlight according to your color, according to your need. Some can be for diagnosis, some can be for management, some can be for clinical features, and you can use whichever base material you like. Like I really love Boards and Beyond slides. Like use slide as my text, but yeah, you can definitely use and like you can choose not to highlight anything that you already know, so you can save time on revision. So this Devam strategy is not specific to UL notes, it can be applied to any preformed base material. Now let's move on to Poorvi strategy, which is radically different.
Yeah, so anybody who is going to listen to me, remember my context. I was working throughout, sneaking my way in my day from my clinic to actually study. So first, answering first question, what is it used for? I will not make long notes. I will not flood the page with any writing that I am just so pissed off while I'm looking at it. Like it gives so much pressure when you look at so much information. It will not be very convenient when you are looking at them while sleeping, when you're looking at them before, just like tomorrow is the exam. If I'm looking at them today, it will be very distressing to me. So I write very minimum material. This is some snapshot from what I did for myself. Second thing, when I used it. For example, I completed my allergy block last week. Right now, I'm on my cardiovascular block. I'm getting bored and getting frustrated with cardio block. I would go back to my allergy notes, which are hardly 5 pages, and just review them so that my concepts don't get lost. So this is when when I use them, like for revision, uh, a parallel revision, and just the day before exam. How I made them. When I started my journey, as I said previously as well, step one spoiled us by giving so many resources, and step two was very different. You do not have any resources, you go into the UWorld. I started off by reading some of the notes from Master the Boards. I was really disappointed from the notes, and every notes for that matter. They all talk about acute limb ischemia, for example. But the problem is, UWorld does not tell you it is acute limb ischemia. UWorld does not tell you it is myocardial infarction. It is you used who is able to uh, determine whether it is acute limb ischemia, right? So no, none of the notes that are out there actually talk about presentation. So all my notes were about presentation. So I talk to myself, for example, this slide. I talk to myself, somebody presenting with nausea, vomiting, constipation, and had air in the small intestine. What do I talk to myself? I know it is obstruction. What am I prompted to look at in the question? Go back, please, Arjun.
Yes, sorry.
I am prompted to look at the air in the colon. If there is air in the colon, I will think it is partial obstruction and I will observe the patient. If I see in the further question stem there is no air, I, I I tell myself it is complete, take to the OR. Similarly goes for here. Nobody will tell you in the U world that this patient has H. pylori or this patient has cancer. If somebody comes with as simple presentation as dyspepsia, more than 60, I will scope. We need to mute him.
Just a minute. Uh, I think everybody is on mute. Are you still hearing the disturbance?
Yeah, yeah.
Let me mute.
Yeah. All right. So, for example, if somebody came with dyspepsia, they don't tell you that this patient has cancer or not. And all the notes talk about cancer, right? So, I always made the presentation based notes. For example, somebody came with dyspepsia. If more than 60, I will take to the OR and scope the patient. If less than 60, I will do the H. pylori and then scope if there is alarm. Similar goes like this, wart based presentation. If there is warts, I will talk to myself, is it genital warts? Is it plantar warts? If it's plantar wards, my first will be salicylate. If it is genital wards, it'll be imiquinate. So my all notes were presentation based, very short, so that I don't get swarmed into them. I don't get upset by my own notes, and it is very easy. Like a whole UWorld can be concised into less than 50 pages, I would say. I still have them preserved, and it worked wonders for me. Arjun, can you go to next slide? Similarly, if there is rectal prolapse, I talk to myself. If I see concentric rings, I will take the patient to surgery. If I don't, I will observe. If I see somebody who is exposed to varicella, I will ask myself, what is the question? If I see somebody with sickle cell, with osteomyelitis, what will I do? If I see somebody, a normal child without sickle cell with osteomyelitis, what will I do? So my all the notes were kind of presentation based, because I did not want to study the notes which do not help me with diagnosis, which all the notes were I was disappointed by, like master the boards, UWorld notes, whatever is out there. They talk about myocardial infarction. Nobody talks about how to reach myocardial infarction or how to reach about from a presentation. So this was some of the example which worked wonders for me. And
Thank you, Purvi. Few of the other example, I
yeah,
think you
this
have
was
already
this was very interesting too. You
yeah.
always like, as simple as snoring. Some of the questions they'll tell you, okay, adenoidectomy. Some of the questions they'll say alcohol. Some of them no sleep study, some sleep study. So I just decided on myself. If somebody just presents with snoring, I will stop bang myself. I will see that, okay, if stop bang is positive, just 0 to 2 to 3 to 4, I will do conservative. If more than 5, I will do this. So, and on the same page, I talked about stop bang myself, that how will I remember stop bang? Snoring, tiredness, observed apnea, pressure, and then go about it. So the same page, it would answer so many of the question stems. It would answer me a presentation snoring, which will require just conservative management, a snoring which would require surgical management, a snoring which would require sleep study, and then go from there. So these were just a few examples of my notes, and I did read them on the day just prior to exam, and it kind of helped me keep my mind sane.
Very, very interesting way to take notes, I must say, and I really like it. I will try it myself for step 3. Let's see.
I can sell them to you.
Oh, I will not pay you money. Don't worry. Okay, Puri, can you like clean out your
Yeah,
note annotations?
yeah. I'm trying to.
Can I?
Is it? Yeah, it's going away.
Yeah, it's gone. It's gone. All right. Before moving forward, Mati, so I haven't received your notes, but what are your thoughts on notes?
Well, about notes, I think I don't have them. Even if you had asked, I wouldn't be able to give it to you. So I think my approach was kind of similar to what Purvi did. I had a small notebook, and once I received my score, one of my friend he came to me, hey, I need this notebook, and I gave it to him. And I told him, you won't understand it anyways, but just take it because I can't tell you, I cannot say no to you. So I had a small notebook every day that I would do questions. I would like from every questions or from every option, 3, 4 words from one option, maybe a sentence or two from the whole big explanation. But those would be not like vague things or not, but there would be like very clear cut points. When I would say, okay, if I get these two options, what am I going to these two options, what is the most distinguishing point? And I would note those distinguishing points. And for example, if I had to, from a table where there are like three, for example, if I have a table regarding the, okay, this is the presentation, this is the diagnosis, this is the management. Let's suppose there is a table about two diseases, acute limb ischemia versus chronic limb ischemia. So there is diagnosis, there is then presentation, and then at the bottom there is management. So from what I did, that most of the times you would know the presentation because you have read a lot, you are into this journey, you are studying for 1.5 year or a year. So the stuff that I would know, I would not annotate it, but the stuff that I would not know, for example, there are 2, 3 things about management, 2 lines about one, 2 lines about the other. So I would note only that thing which I would not know. So this is the management for acute, just take the patient to the emergency, do this and this, and if it is chronic, give them drugs or whatever. So I would note only the things that I didn't know, and I had a small every day that I would finish my UWorld. I would have 2 to 3 pages of notes with myself, and just after I'm done, relaxed, I would just go through my notes, what I did today. It would not take me long, maybe 10 to 15 minutes because I had written only 2 to 3 or maybe 4 pages at max. So at the end, I had like those, just like she said, I had those 40 to 50 pages of notebook that I had with myself, and I would revise that whenever I had free time or I did that before exam. So my approach was similar to the more what Poorvi did, because I had made flashcards in my step one. It never worked for me. I didn't read a single flashcard that I actually made. So and first in like step one, I already had first aid. I made notes on the first aid as well. But for CK, I didn't have like a base material kind of stuff. So I try to make my notes with whatever I did not know. And sometimes if I like, sometimes you know that you know something at that point, but later on you forget. So what I would do is once you solve a question in the UWorld, and then you go to search, and then you can type a term. For example, I said acute limb ischemia. And if I was confused, like I would say if I had insufficient notes, for example, I noted 2, 3 points, but I don't know 4, 5 points about a topic, which I already know that it was explained in the question. So I would go to the search strategy, write acute limb ischemia, 4, 5 question pops up, and then I would read again on the whole explanation. Okay, this is this. So in this way, if there was some deficiency in knowledge, I would try to address it that way. But more of the times I would just take my short notes and use them for my future.
This is the
Okay.
tiny book,
Yeah.
this smaller book, and that is also half filled, like not even fully filled, so that you don't get overwhelmed by your own stuff. Was my thought process behind it.
So the thing is, with my notes, you notice the orange segments I showed, right? They were very few and limited. So indirectly, I was doing what Poorvi was doing. The orange segments were stuff I looked at regularly, not the other parts. And they were few and far between, only stuff which I purely like had to locify. This presentation go this path, this presentation go that path. That is why the orange star was there. So I'd go through maybe 100 pages of notes in barely 15 minutes because those are few and far between.
Yeah.
That's why the color coding was there to differentiate. But I understand what she meant. You cannot, sometimes it's scary to look at 100 pages. I was used to it, so I just flipped through it fast.
Right.
But
So
that also helps.
everybody will have a different way of working around, but the consensus would be keeping it short and very concise. If you form notes like Arjun does, no offense.
None
You
taken.
should be able to revise it in
Yeah.
max, if you have to take it detailed also, max to max 15 days.
Exactly.
In very detailed notes. Anything more than that, you will not revise at the end. That's
Yeah.
total, complete.
Yeah, for that purpose, people have already formed first aid, right? You don't have to create your own new material. You have something which is already there. What works for you should be done, like, 2 days before exam. What would you do? You would fall back on your own reliable stuff.
So if I want to say as a summary of things, like I think the rule of thumb over here is like make notes, keeping the revision in mind, like how you are going to actually revise the note. Like would you be able to finish it? Is it helpful to you for your own purposes? If both of the things are checked, like you are able to finish, you will be able to finish as well, and it serves your purpose, then any kind of note is fine. That's my takeaway from this. I'd like to share my manuscript kind of notes. So it's you don't have to type it like I did, but I think it serves a very unique the purpose I explained during the question itself. For example, this is like if you see on the right side, AV fistula, femoral artery pseudoaneurysm, retropedial hematoma, femoral nerve injury, and acute limb ischemia due to femoral artery dissection. if you see these, like these are the usual differential diagnosis or options. It is that comes in a question where patient has undergone some femoral vascular access for catheterization and had some complication. So my point of keeping all of them together over here is like how to differentiate between all the five options. So in any way, in any question can be formed in any way, and answer can be any of this. But if you are seeing like patient has, like for example, let's go to first part. Patient has only mild localized pain. There is continuous bruit, not only in systolic part. There is a difference between that, and there is palpable thrill, and distal pulses may or may not be diminished. It is most likely a arteriovenous fistula. But then why it is not a pseudoaneurysm? So pseudoaneurysm would be tender and pulsatile and has only systolic bruit. So in that case, you can choose femoral pseudoaneurysm. And another thing, suppose same patient who undergo femoral vascular access during cardiac catheterization, but he has now flank pain and very kind of rapid hypotension within last 24 hours, then you definitely should think of hematoma. And similarly, if there is some neurological component like discomfort or paresthesia in thigh, or is there any, let's say, upper neuron motor component like patellar tendon lower motor neuron component due to nerve compression or nerve injury, patellar tendon hyporeflexia, you should definitely think of femoral nerve injury. And same way, suppose the patient presentation is in emergency, like acute limb pain and pallor, and there is no bruit or thill, then you should definitely think of femoral dissection leading to limb ischemia. The whole point is like how to differentiate between close diagnosis, and you can put it like in Poorvi's way in your short handwritten notes, however you want. The goal here should be how you can differentiate between close diagnosis. Second, yeah, this is similar thing I said. You can take this as a like diagnosis question or pattern recognition as well. Like the left side is just simply 2 or 3 lines pattern, and you can simply derive the diagnosis. And question can be about management as well, but you definitely have to diagnose the patient first before you can decide on the management part. This is like a similar thing, but like suppose there is acute limb ischemia. Patient is in emergency. Patient has severe pain, tenderness. But how can you differentiate between whether or not it is due to emboli from heart or it is due to local arterial thrombosis in a patient of peripheral artery disease? So you have to look for history now. Like it can be sudden. If it is sudden and severe and there is no pre-existing claudication, you definitely can rule out peripheral artery disease. But it is sudden severe, but the question stem says that patient already have a history of claudication, like pain during walking, and there are sign in unaffected extremity as well, like chronic sign, like little bit diminished pulses or something. Then you can think toward like, okay, this is a patient of peripheral artery disease, and the thrombus has cut off from the main plaque, and it has formed a thrombus, and it has led to acute limb ischemia. So the point is you have to know and note down in a way that helps you to solve question either of diagnosis or either of management or either of differentiate between two closed differentials. And this is another example of different kind of note. This is for like management only. Suppose you have already derived diagnosis, supraventricular tachycardia, based on the whatever presentation question stem gives you. Then it will ask you like, okay, how would you manage this patient? So then there will be like three situations. I'm just giving you a simple example. Patient might be simply stable. So they will ask, okay, what is the first thing would you do? So first thing would be either IV adenosine or vagal maneuver. There is like rationale for it. You don't have to read it all the time, but you can simply see the bullet point. Okay, this is the first thing to do. But if question already says, okay, patient like the doctor has already given IV adenosine or doctor has already done vagal maneuver and SVT has not resolved, then what will you do? So then it is like second next step in management. Then either you can use IV beta blocker or IV calcium channel blocker. And suppose the question system is like if a patient is with supraventricular tachycardia and it is he is hemodynamic unstable, then you forget about everything and you simply go towards immediate synchronized cardiovascular. So this is the algorithm I had in my mind. This is the way I store information. You can use your own notes, but the target should be how to diagnose, how to differentiate, how to manage, how to go step by step. And however brief you can make, then it's good for you. All right. I think this
I think
is,
Arjun,
yeah.
I would make one comment because when you start preparation, there is a certain kind of motivation. Like when you start preparation, you are like a very big magnet, right? You want to attract everything. And when you are in the middle of your study, you become smaller and smaller and smaller and smaller. At the end, you just want to pick a small, small stuff. So if you are going to, I mean, it's your way. I know you have that kind of capability that you try to look at the smaller and smaller thing. You can make these notes, but I think if you ask me, I will make it maybe for 1 hour the first day and then I'm gone. I think you need to understand yourself, how much can you endure? Because I mean, if I take this exam 100 times again, and 100 times I would be unable to make such a detailed note. By all means, I will never be able to do it because I don't have that stamina. Even the smaller notes that I would get, if you see my first half and then second half and then third half, if I write 5 lines from the first half, it becomes three in the second half and then it becomes one in the last half. So that is how a human nature works, because and it would take a lot of time. So I would recommend, or if you have that kind of ability to take longer notes and then you can continue it, just do it. But if you don't have that, then try to find out a way that works best for you. We as a panelist have shared our point of view. Somebody is using a preset material, someone is just writing smaller notes, and then somebody is like Arjun who writes very much detailed notes with all the reasonings written out there. But you are the one who knows whatever works best for you, and just I think go with that.
If you think you have an attention span as short as an ant like me, then my method works. If you are really, really motivated and can concentrate, then the other methods work, kind of thing. So decide for yourself.
Know yourself and do it accordingly. All right. So before we start last phase of preparation, let's take a 10 minutes break. I think everybody needs it. It is 11:50 over here in US Eastern Time. So we'll meet at 12 p.m. For India, it is I think 9:20 p.m. right now. So let's meet at 9:30 p.m. Indian time. All right.
Yeah, I
Everybody
think
can, yeah,
let's keep it 10 minutes so everybody knows according to their time. Maybe there will be some people
yeah,
joining from some other places. So just let's keep it 10 minutes and say we'll be back in 10 minutes.
yes. All right. Okay.
Arjun?
Okay, shall we start?
Yeah.
All right, so now we are in the last phase of step 2 preparation and our webinar as well. Last phase can be phase 2, phase 3, but it should be last anyway. Devam, you might want to tackle this. It's your slide.
Okay. Let's get it rolling. So I will just briefly say what I did in my final pass, but disclaimer, it varies person to person. But the general consensus, I think even the others might agree, is last phase has to be timed and random. It has to be timed because you have to, it is, if you have not done time before, you have to put yourself time pressure now. It has to be random because the entire exam will be random, it will be varied, and you want to do it random to understand that you can switch from topic to topic and still be effective with each question. The only scenario where you might consider system or subject wise is if there's a glaring, for me, OBS was weak. I was doing 90% of the things, I was doing barely 40, 50, 60% on OBS. So then you might consider doing that specific system or subject, whatever it is. But majority of it should be randomized. And my strategy used to be usually do UWorld in the morning, start off with a few blocks, couple of blocks, timed, and then while reviewing, don't review everything. You have made your notes, you've already reviewed all of these. Review only the stuff you get wrong or stuff where you had a 50-50, like you felt you purely had to guess. You have two options. So go specific those questions and review quickly as to where was the confusion? What was the point I was missing out on? And if it's wrong, then you know it's wrong. So do that. And another thing I used to do is I used to maintain a small notebook for the blocks I did. I would note down the mistakes I keep making. And next to it, I would have a tally mark space available. If something would cross maybe 4 or 5 times, then it is a critical area. I'm repeatedly making an error. So then I would go and read the notes completely, like not just the highlighted points, as in like the orange parts are my highlighted points, only the management or specific keywords. But if I make a repeated mistake, there is conceptually something wrong. So I would go and revise the entire topic top to bottom with etiology and diagnosis treatment to understand what's going wrong and cover that deficiency. This was more or less my strategy with UWorld in my last phase of preparation.
Poorvi, you might want to cover if you have any comment on this.
Yeah. So second pass, I realized the mistakes that I was making in the first pass, I continued to make in my second go as well. So just randomly doing all the questions all over again in the second pass was not feasible for me, given the time constraint. But I felt it is not even essential. Like, if you know certain things, you know it. If you don't know something, you will not know it. It is as simple as that. And only first pass might not be sufficient. So my strategy then, I tailored it. Like I started doing second pass because everybody said you have to do it, you have to do it. But I realized no, it is not worth the time. If I knew, for example, if I knew pediatrics, I knew it. And there was no sense in doing it all over again. If I did not know psychiatry, I did not know it. So there was sense in doing it. So I would highly dissuade a person to go through all over UWorld again, given in present scenario that the questions are 4,000 plus. Imagine what are you signing up for, and it should be worth your time, right? So I would say, if you are particularly, you are weak in a particular subject, I would recommend doing the whole second pass for that particular subject versus system. If I was weak in OB, I could do second pass for OB and leave alone the pediatrics, internal medicine, and surgery. Or versus if I was weak in a particular system, for example, I was weak in maybe renal system, I would do second pass for the renal system versus going through all the 4,000 questions again, which is definitely not worth the time according to me. So I would tailor it according to your needs. And second important thing that I did for myself, which worked out very well, was going through only the marked versus wrong questions in the second pass, because there's a reason you marked them in the first go, and there's a reason why you were not correct in the first go. So going through those particular questions instead of randomly doing 4,000 questions, I would highly recommend against it. So my second pass was identifying my weak areas, going through them, and going through the wrong and marked questions was my strategy. Again, timed manner, so that it's a practice. I will still stress and specify that I am pretty fast reader. Like I can go through the question stem pretty fast. Still, the major problem that I faced on the day of exam was time. It is very, very, like 60% of the questions are quite long. In fact, I joked about 2 screen long. Like you have to scroll through the screen to actually complete the question. So if time is a constraint, then you have to practice your time management. And a second pass should be very much timed so that you practice enough. So that's my consensus about second pass. Identify your weak areas, focus on them, uh, and identify your marked questions and ask yourself, why were you wrong? What were you doing wrong?
Well, if you ask me on this, I differ with Purvi, but I agree with Devam. That's how my approach was. Because I personally believe, for example, if I'm doing the UWorld system wise, let's take a question that we have already discussed. So if I am doing cardiovascular system, I would be able to have more grip on the arterial embolism portion or the venous embolism portion or venous thrombosis portion, right? And then, okay, then I do that system, then I move to neurology, and then in neurology, I would have more knowledge about the neurologic uh, uh, aspect of that similar question, right? And then after I'm done with the neurology, cardiovascular, then I go to, I would say just go to the vascular type or rheumatology type, any other system where I would have more options about the inflammatory disease, like the vasculitis portion if I go there. So this is how the first pass of the U-word works. Like you do one system, then you do another system, then you do another system. System-wise you do, but when you are doing the second pass and that is random completely, then you can actually, where you have already done first pass system wise, that is the time of your brain test. How are you going to integrate what you have done system wise previously? One system, second system, third system. And then the second pass is a point where you actually integrate your knowledge and based on your whole spectrum of knowledge that you have done from your first step, and then how you integrate those systems and get into the right answer. So for me, I think if you ask me what works the best for you, I think I did the first system wise, the second random, and I think that worked for me, and I would highly recommend to do a second pass time random because that is what worked for me, and I think most of my friends use a similar strategy because I believe the first pass is more of a knowledge foundation kind of thing, and the second pass, then you actually, when you have touched everything in detail, and then you come to the real exam type of scenario, and then see if you can integrate all your knowledge that you have done from different systems into a single question.
Okay, so I think the consensus can be made over here. Like at least everybody agrees on first pass being more segmental, like system wise, to build up the knowledge tree, and second or final pass can be usually random and definitely timed because you want to practice for exam. Because yes, Purvi is really, I really agree with Purvi. Exam is really long. You will be pressed for time. However, like even if you are very knowledgeable or very practiced, still you might be short on time. So second pass or final pass should be timed, random. But if you are weak in some specific subject or system area, that you can tackle it in a segment of specific manner even for the second pass. Now there is one scenario, like suppose somebody is watching this video right now and they are already done with their first pass, but they are not so confident about their first pass or their knowledge base they build up from that. Would Should they treat their second pass as a final pass and do everything random in time? I believe you will be the person would be the best judge. If they are not sure, they can even do the second pass as a like systemic way, as more segmental way. But then the issue, as Devam pointed out earlier, comes of like remembering the answer questions. So what can a person do? So they have to, for a like actual exam practice and final pass, they have to do some other question bank, maybe MBOS. It is not that good, obviously, as per the UL, but still, it is something. Some other question bank, some other question for random timed practice. But ultimately, last practice should be random time, definitely. If you do like Devam, like the timed from the start, that's the best thing. Like you will be really up to the speed till your exam. But the last part is definite. Last part should be definitely timed. Anything else anyone want to add in summary?
Yeah, so this particular question, when you asked what if somebody has a horrible first pass, that is me. I had a horrible first pass in certain aspects. As I said, 11, 16%. Oh my God. So you know that if you're horrible, you're horrible. Nobody needs to tell you that. So before jumping to second pass, it is no use, right? I mean, if you are not performing well, you will not perform well again on the same scenario, same questions, same knowledge. I mean, same base of same setup. So I had to fill in something. What can I fill up with? Instead of questions, I need to go back and really look at the concepts. It can be first aid. It can be boards and beyonds. It can be your own textbook. It can be whatever you want. Like, you know, where is the best material for you. It is tailor made, like it is tailored for you yourself. So first aid, for example, first aid for psychiatry worked for me. And then when I gave my second pass, it made much more difference. It made much more sense to me. So if you're horrible, I would say before jumping to second pass in the similar scenario, similar set of questions, you need to do something. In fact, if somebody thinks that he or she needs to try tutoring for that particular subject, yeah, it is worth doing. Like a particular system worth enough can really change your score. So identify your weak areas before jumping to second pass and fill up with some knowledge from wherever you can get.
I just had to add one disclaimer for the listeners. When all of us mentioned first aid, we mentioned step one's first aid, not step two's first aid.
Yeah,
I realized we didn't clarify
are,
till now.
Yes.
yeah, we will not recommend or talk about step two first aid as a like general thing. I'm not. I don't think we have anything good like recommending any recommendation about step two first aid. Don't do that. So this is kind of Devam summary how he did his thing during his second pass, or let's say for everyone's final pass. So I think it is covered. Like he reset the UWorld after the first pass, solved everything, solved and review
One other
question.
thing I had to add
Yeah.
is, like Poorvi
Yes.
mentioned, the 4,000 question doesn't make sense. I never finished my second pass. I both step one, step two, I went to 80%. And if I knew my exam is close, I would targetedly do the systems I felt as weak at if I was. The goal was to one, assessment, yes. But second, by doing at least 2 blocks a day, it was more exam practice. As in, I'm having stamina that 2 blocks in any day I can do at least. And plus, when you're just reading, you are not in a mindset for questions. So at least if I do 1 or 2 blocks, that mindset is also maintained. That was a target behind doing those 2 blocks as well every day. Like I wake up in the morning, I do 2 blocks. It's my routine. So an exam day didn't feel unnatural to me to wake up and do 2 blocks. That way also it was like not just assessment purely, it was stamina wise, getting used to the setting wise, all of those little things as well, as to why I did in a certain manner.
Anything you want to like add to our discussion for this final pass thing from your slide?
I mentioned everything. No, I think so. I mentioned everything.
All right. Moving ahead.
Let's answer the question right now in chat because it's relevant right now.
Yeah,
2 blocks
Okay.
in a day. 2 blocks in a day. Yeah, but you cannot do 7 blocks every day. No marathon runner who runs 40 kilometers does it every day. You're human. They do it once, maybe twice, which we'll come back to later. There is a slide for it. But not every day. You cannot burn yourself out. You have to build up to it till your peak performance on the day it matters. If you do like early on 7 blocks every day, in 10, 15 days, you're done. You will not show up in the exam.
Okay. So yeah, the important thing, parallel revision while you are doing your last pass thing in UWorld. What are your thoughts on that?
Highly recommended according to me. We keep on a particular system, actually in the first pass, especially youth systems like cardiovascular, neuromuscular, whatever, they especially if you're on that particular system, you might spend some 2 weeks, 3 weeks on that particular system, and what you read before those 3 weeks might completely just wash away. So I would highly recommend parallel revision, but sometimes what we do, where we err on the wrong side, is the revision can be really, the thought of revision can be really tedious to you in your mind. Oh no, I have to revise this. Oh no, I have to revise this. But that tediousness comes from extensive revision if you plan to. Just revise your wrong questions. Just revise your notes if you have made. Just revise your approaches. Just revise your uh, basic concepts where you were wrong. So I highly recommend revision, but I do not recommend extensive revision. I just recommend spending some 30 minutes a day, 15 minutes a day in going through the previous system. That will not hover over your mind that, oh no, I have to revise, that method, and you're never successful. You'll never find the time of the day when you actually sit and revise the previous system. I would say short revisions, but in short time spans, but doing it daily, or especially when you are on a new system, doing the past system revision in a concise manner goes a long way.
So for me, I used to revise every day, but it has been targeted as in I would do my blogs, I would review them, and then I would read. I would decide, okay, today I used to allocate, I would read a few pages. I would have a target per se specific. I would read a certain number of pages. Just more so to revise the facts, not the concepts. Because in my first pass, I would not focus on memorizing things too much. But come second pass, there are some factual segments which are pure facts. So I would focus those. And the rest I would just skip through pages just to take a glance. And at the end of my days, when I would be more focused again on the wrongs. So like the half an hour, 1 hour would be very targeted that the mistakes I made. So them I would read a little thoroughly. The rest I should just read for the not sake of reading that's wrong, but I would not stress over it either. I'm just like it's a storybook I'm reading through pages. That way I approach my revision.
Yeah, for me, I think it's the same. When you're in the last phase, you do need to revise stuff because exam is not purely concept. And I think if you already have passed step one, you may have an idea about that. So because there are not only concepts that you think if my concepts are clear, I'm gonna do it. There is a lot of stuff to cram as well. So you have to kind of keep in mind, and that stuff is this stuff you forget very much easily. For example, if you did 1 week back and you do not read it, like again and again, you are going to forget. So I always had my notes with me for the last phase of my preparation, and whenever I find it convenient, uh, I would just get for example, I am lying in my room and then uh, I just feel like I should get the notebook. I did that, but you have to figure out the best way for yourself when you can revise. So I always found at my comfort, for example, if I'm going to start two blogs, so I just take my notebook and read the stuff and then I start my blog. So that is purely up to you, but it's not like, okay, you never feel like doing a revision, so you said, okay, I think I shouldn't do. So by that, I don't mean that you need to revise, but how you need to revise, that is up to you. For me, I always revised, especially at the last phase of my preparation, the things that I needed to do from first aid, the things that I need to revise again. We have a slide about that at the end. We will discuss how you are going to do the first aid and what you need to do it. But I think at the last phase of my preparation, there was always parallel revision, because without revision, only question cannot get you there, and not only revision can get you there. So you have to manage your routine in such a way that you are with the question and then you are also learning things and cramming stuff. So, for example, if you are too much into revision, you lose the reflex of question. And I think if I say the reflex is so much, if I can emphasize, the reflex is so much important to have for questions. And a good example would be I took my step three exam like 2 years after I did my step two. So the only thing I think step three U word is similar to step two one, but the only thing why you need step three U word is because you lose that reflex. And I did so much better on my day two of step two exam compared to step one, because I already took day one and I knew where I was doing wrong things. And all of them was because of the reflex that I had actually lost and I had developed back then. So a 2 years gap, actually, what caused it to me, it was a loss of reflex. And similar is the case with your last phase of preparation. If you are out of questions for 1 week, you will commit silly mistakes, and you would say, and that is a human nature, like, and you don't want to commit those silly mistakes and try to minimize the human error as much as you can for being in practice. So I would strongly recommend both the things going in parallel, because you cannot put one aside and then say, okay, I'm just going with this one. So both questions to be in practice and not lose your reflex of question, and then revision so that you know the facts that are going to be tested on the exam.
One small part I'll add is when you're revising also, there are certain things which are absolutely like you either know it or you don't. One prime
Yes.
example is pediatric milestones. You know it or you don't know it.
Yeah.
So that is but you know if it comes to the exam, you'll guarantee that answer. So what for those certain stuff you want to do is keep that for the last week of your revision, because it will be very, very fresh and you'll guarantee you marks if you shows up on it. This you'll know once you're revising, but you plan out your revision as such in that sequence. So statistics you want in the end, the formulas, because again, they're guaranteed marks. Periodic milestones, one example you want at the end, they're guaranteed marks. There are very few such things, but they're guaranteed marks if you remember them. Otherwise, you cannot get them. So when you're revising, plan it out that way as well.
Yeah, the other guaranteed marks I would say is that USPS task force recommendations for screening. Oh my God, I cannot emphasize enough. The screening for all sorts of cancers and whatever they have. Just make sure you revise in the last week.
All right. So excellent summary, Mati, and great inputs as well, Devam and Poorvi. Let's move on. So, one of the most important part in last phase, assessments. When to do it, what is the sequence? We will cover everything. So let's tackle it one by one. When to start? Mati, you can take it. Yeah.
Yeah, so I think I would say for me, when I did first step 2 CK especially, I gave 3 assessments. If I would say, one was the NBME 7 that I took almost, I think, 20% or 30% into my second pass. Because as I mentioned earlier, it was COVID and it was free, so I thought maybe I can take it and test myself. And then I think once you are into the second pass of the UWorld and you have done like 20-30% and you are like kind of more habitual to the random time thing and you have some practice, then you can start testing yourself. For me, like I think that NBME was probably, I would say, 6 to 7 weeks before my exam. And then once you know about the result of your assessment, based on that, you need to improve where the weak areas are. If you are weak in certain aspect, or if you are getting a particular system is weak, you need to revise that. And then once you are doing another assessment, you need to see if you have improved on the previous mistake that you already did. For example, if I'm committing mistakes in biostats and I go back and I read my biostats and then I took my other assessment, whether I'm improving on that or not. So my timing was 6 to 7 weeks before I took NBME 7, and I think 4 weeks before my exam, I took UWorld self-assessment exam 1. That was most probably, I would say, at 50% of my second pass. And then 2 weeks before my exam, I did my UWorld self-assessment 2. Once I did better on these two, I was kind of relaxed, and then I continued my revision and question practicing stuff. And then 1 week before my exam, I did the NBME Free 120. So I think based on your performances, you can judge how many assessments you need. If you need more, for example, if you don't do very well on your assessments, in the very first assessment, you may try to chip in some more assessment like other NBMEs, CMS forms kind of thing. So depends on how your performance is and where you are actually in the spectrum of preparation. So if you are doing really well, you can be fine with 3-4 assessment. But if you are not doing really well, you need to increase the assessments and then try to visit your mistakes and look for improvement in the other assessments. That was my time frame and how I did my assessment.
I had a slightly different thing. After my first pass, I wasn't sure where I was. Like, it's a subjective feeling that you know versus you want an objective marker to tell what you know or not. So I took one free NBME again in the COVID era, immediately after the first pass, or one or two systems remaining, but just took it to actually assess my progress, whether I was good enough or I need further more good reading or foundational knowledge. So I took one NBME immediately after I thought I have done most of the subjects, to actually tell whether I'm good enough to start the second pass versus start the revision process, versus I need to go back and do a few systems again. Rest again, how the sequence follows, as Mati said, UWSA ones and NBMEs, but I took one just after the first pass to know myself.
So I have a middle ground between both Poorvi and Mati. So I took one immediately after I took UWSA 1 actually, immediately after my first pass, because I wanted a picture of where I was at. So I could know what, if I need to go back to first pass or if I can start my second pass and second pass, where to improve. Also, UWSA 1 is supposedly a feel good exam, as they call it, mocks. You don't want to take an extremely hard NBME off the bat. Your confidence goes, and then it's a very bad place. You want something that's light on you. So UWSA 1 was a good suggestion that way. Then I took three NBMEs, 9, 10, and 11. And I would usually space these out based on how much my second pass is going. So maybe 1 week or around 15 to 20% of UWorld done second pass, I would take the next NBME. And there's no hard and fast rule. I did based on feeling. Like, am I feeling good this week? I take the NBME. If I'm not, I give it a few days. And but the last NBME or mock, which was UWSA 2 for me again, because again it's a good exam and feels good, and you want to end on a high, should be 15 to 20 days before the actual exam. The reasoning is any closer to the exam, you will not be able to improve on anything you want to improve after looking at your assessment. So that buffer has to be there. The free 120 is a different scenario. You take it around 1 week before the exam, because that is more to do with getting familiarized with the exam's UI, the tutorial mode, which are time you can save on the actual exam date. So that is, and the sequence matters in some way because you want to start off on a slight high when you are starting a second pass, and you want to end on some sort of a high. You don't want your confidence shattered 2 weeks out from your exam. So do keep that in mind when you choose your NBMEs or UWSA.
Okay. I think we covered most of the things. One thing I just want to put it out there, offline versus online. So there is no debate why one should only take online exams, but what are the positives of it or why it is so necessary to do so? Our panelists can point it out.
Online gives you first. It is timed and you're under the constraint of time. No matter how much you time yourself, it's a different thing when the time is ticking away in front of you. Secondly, it gives you an assessment report. You get clearly what went wrong, how much percentage went wrong. Is your diagnosis a problem, your management a problem, or a system a problem, which you do need. On offline, you will not get that sort of feedback. And that is more important than the assessment itself. If you don't have the feedback, you do not know where to improve. The goal is to improve, not to just take an exam for the sake of the exam. That is why online is very crucial.
I think I totally agree with what Devam said. There is absolutely no alternative for online UWorld. And online UWorld give you assessment, it's an exam kind of feeling. And the other thing is the most important thing that I have actually that we may not actually know its importance. That is once you pay those $600 and you know that after 6 months your UWorld is expiring, right? So you are going to have that kind of, okay, now unless you have online UWorld, you are not actually into the path. Let me put it that way. Because buying a UWorld, putting that investment of $600, that is apart from what we Devam discussed, that this assessment tool in the other, that is. But I think what I also notice, and always advise my juniors, once you buy the online UWorld, you kind of have a feeling that you are actually in this pathway and now you are going to take a test. Because if you do it offline, you may not give that much attention to it. You may not do the required amount of questions daily. You are actually not committed to the path. And I think the most important thing to this path is your commitment. So once you buy online, you have the time constraint, 6 months, and it gives you a feedback. Oh, I did well, I did not do well. So that keeps you motivated. I think I did bad, so I need to do better. I would say online UWorld has all those aspects, both in terms of your preparation for the exam, in terms of simulation with the exam, and in terms of your commitment for the exam that pushes you actually to study and is another form of reinforcements into your pathway, into your struggle that you are going to be taking an exam.
Okay. So, any thoughts on, as we are talking about assessments, any thoughts on like underestimation or overestimation of score? Because it is a matter of debate online. People talk at this exam, NBM is usually underestimate and UWS is overestimate. Like, what are your thoughts on that?
It depends when you take it. Yeah, like if you take a UWSA very early on your pass, you will underscore than your actual score. You take an NBME very late in your path, you might overscore than the actual score. I personally outscored all my NBMEs and UWSA, except one, I think so. But it's just a very irrelevant. Plus, you don't know the mood of that day. You wake up having a bad day, didn't sleep well the night before, you're going to do poorly. Vice versa, you wake up feeling extremely great than usual, you will do better. So it's safe to say, I would say leave a plus or minus 7, 8 buffer either way, and don't focus too much on the score you get from it. More like look at, are you scoring more than your target scores on your assessment? If you're scoring more than your target score, then don't think about it. Then just focus solely on improvement. This block was weak, let's improve on that. So my target score, it might seem very less, was 250. I worked with that. I definitely outscored much more than that, but that was my target score. So I was happy as long as above it. Then it's solely about improving, not about how accurate will my actual test day score be, because that is subjective. It depends on your health, depends on your mental state, depends on a lot of other variables. So yeah.
Yeah, but usually what we do is we take a UWSA 2 to 3 weeks before exam. If you actually do that, if you like most people do, then I think it is quite a good estimation. I wouldn't say underestimate, overestimate. I think it's a quite a good estimation given you take UWSA 2 to 3 weeks before exam, and it's fairly predictive, I would say, and it's not brutal at all.
Okay.
I think for me, if I say my personal experience, it predicted me very well. My actual exam scores were the average of both my my first and second assessment. So I think I would have a kind of similar thought about the UWSs like Devam. You need to have, there is a certain points, like there is a certain cutoff score that you actually are targeting. And if you are there, it means you are good with your preparation. I would not say whether it reflects your exact score or not, that's a different story. It differs from person to person and depends on the circumstances in which you are taking the assessment and the real day exam. Uh, some people may be more anxious during the exam than doing an NBME, sitting in the comfort of his home, those kind of stuff versus the real pressure of exam where you think, oh, this is my lifeline, whether I do good or bad. So I think if there is a certain target that you can achieve, it definitely reflects your preparation. If you are doing well on the assessment, that means you have prepared yourself well for the exam and you are ready to go into the exam. So I would put it that way. May or may not it predict the exact score, but it definitely predicts your preparation. If your scores in the assessments are good, it means you are there and you are doing the right thing. That's the most important for your exam. So it does reflect your preparation. And if you do well, there is higher chances that you are going to do well on your exam as
Okay. And let's talk about the most important thing, exam simulation. And I'm not talking about simply taking online assessment in the time mode. I'm talking about like how to simulate the exam as close as possible and how it is why it is important to do so.
I cannot emphasize enough. Like for me, it was more of a patience test and sanity test, and not only medical knowledge test. Imagine grueling yourself for 9 hours, like such long questions. Time is a constraint. You are as such freaking out. Like it is a game changer in residency match. So uh, exam simulation, oh my god, if you're not prepared enough, you might really screw up. Like uh, even in spite of having good medical knowledge, if you are not if you have not practiced enough to or trained yourself enough to read long questions, to navigate your ways of answering, you might be knowing the subject very well, I don't doubt that, but time is a very key factor here. And pretty long questions, I would say 60-65% were long questions, and 35-40% were like okay, readable questions in like 4 or 5 lines maybe. So 60-65% is good enough. And remember, you're very charged at 8 a.m. in the morning versus 4 p.m. in the evening. Your energy is going to drop, your patience is going to lose, you are more likely to commit mistakes towards the end of later blocks. I would say simulation is equally important as your knowledge is. So what I did one day, I sat down, gave one NBMA and back to back UWSA one, I guess. So I gave 2 assessments in time mode to actually test myself if I'm patient enough to sit in those 8-9 hours. People do argue, okay, we have given step one, what difference does it make? No, it is very different. Agreed that it was 8 hours, 9 hours test too. It was not trying your patience based on the length of the question. So I still would say, even though if you've given successfully step one for 8-9 hours, it doesn't mean that you'll be sane enough in your step two. So I give 2 assessments back to back to actually streamline and prepare my body and my mind for grueling 9 hours of my life.
Okay. So, all right. To summarize, one can start assessment after the first phase is over, first pass is over, or after like 10 to 20% of second pass is also over, to get accustomed to the random timed question. Offline versus online, always take online just to do the exam simulation, to just to feel the pressure of time as you would feel during the exam. Sequence, yes, it matters. Start with relatively feel good one, which is UWSA 1, and with you relatively feel good one, which is UWSA 2. In between, you can take NBME in whichever sequence you want, but keep the last exam at least 2 weeks before your actual exam date, or like schedule your exam date in such a way that after last exam you have some time to improve on things that you find incorrect or needed improvement during your last assessment. Regarding score estimation, it is always a range. It depends on so many things: luck, the day, the mood, the energy level, the focus, and the exam like difficulty as well. So think about like having a consistent score crossing above your target range. Having a consistent range crossing about your target score, and have a margin of plus or minus 7 to 10. So don't feel bad about if you go up or below a little bit than your average, but usually it works out okay for almost everyone. There are few outliers. In exam simulation thing, yes, you should at least do 1 or 2 full exam simulation with your like 4 or 5 blocks of assessment plus 2 random blocks you can add from UWorld, just to have patience and feel about like how you can sit for 9 hours. And you, during that, you should also learn about like when you get hungry, whether or not you are able to continue for 1 hour, 1 block or 2 blocks. Like it depends. Like I can never continue more than 1 hour. I cannot focus on second block directly if I don't take break, if I don't take my caffeine, if I don't wash my face. But Devam here was able to continuously do 2 blocks simultaneously. But it is not same for everyone. There is no blanket
No, but
advice.
not in the exam. Not in the
Not in
exam.
the
In
exam.
the exam,
Not
I
in
took
the
a break
exam.
after every blank. The
So
thing
it is
is,
all, yeah.
you focus on the energy, yes. And one thing to add random between is definitely exactly know when your body wants to take those breaks. And remember, one thing I've seen people, they get anxious on the exam day. So they're doing well on NBME and they don't do well on the exam. There's a reason. They think they have to do something differently on the exam day. Whatever worked for you on your NBMEs, if you're doing well, do not change a thing on the actual exam day. And how do you do that? By making sure you took the NBMEs, you're sitting in an isolated room, you're not talking to anybody, you're not touching your phone, you're taking the break between like eating, going to the washroom only between blocks. And don't change it on the exam day because it worked for you. Don't experiment. The exam day is the culmination of your efforts. It is not an experiment after then changing things randomly after everything you have done so long. Keep that in mind as well.
Great. All right. So we talked about target score, and yeah, this is the important point. Like sometimes we focus like, okay, I want to get 260 or I want to get 250 plus or something, 270, whichever number. But when you start focusing on the number, the problem is I have personally felt that like you stop improving. So if whatever the score may be and whatever your target's range or score may be, you always focus on learning the material and improve on your mistakes. So by that way, you can like the other in other way of saying, you should not chase the score, you should chase the improvement. And once you cross your target range or like the range you are comfortable with, you can like decide your on the exam date. Okay. All right. And regarding how to learn from assessment and results. So yeah, I think this is an important thing to tackle, how to learn from assessment and its result.
I would advise against, digging into your assessment results that day. You would be already exhausted. Take it as a break day kind of thing. And even if you try to dig into your thought process, why were you wrong? What mistake did you make? You might not be able to get good enough output. In fact, spare another day, like the next day, half a day maybe, to actually dig through each and every question and gathering your thought process. Assessment is not only about marks, whether you score 270 or 280 in your assessment. No, it is about your going into each and every question and forming your process, whether what went wrong, what went right, will I be able to repeat the same thing in exam, will I not be able to perform same in exam. So I would spare another day, go out and chill on the day of assessment, and just have some good fresh air and lunch or dinner, whatever. The other day I would spare good enough time behind the assessment and in fact dissect each and every question.
Okay.
I go exactly what Poorvi said. Take that day off, next day sit and revise. Maintain, there's something which Mati mentioned earlier, maintain a copy or a snapshot of that assessment and to compare with the next assessment and see are you improving or not. As that also serves to focus on where to target your improvements. And if two assessments you have not improved, then there is something severely lacking and you have to introspect what I can do to improve this. Read more, get tutoring from someone, do more questions. That is very personal and you have to decide on that.
Okay. One thing that almost everyone faces, like at least I tend to postpone the exam date, final exam date repeatedly. So how to avoid that? I think Mati and Devam has good advice for this.
Uh, I think if you are targeting, for me, it would be avoid postponing. There is certain requirements when you are going into the exam that everybody does. That depends on you how well you are doing it. But there are certain things that you need to do. For example, if you say there is a source that is UWorld, you have very good understanding of that. And there are some other miscellaneous things that you did. You did your first aid stuff, whatever you needed to do. You did your UWorld. Then you are going to, if you are going to postpone your exam, that is for no reason, or you need to have a very strong reason. For example, there is some unprecedented thing that has happened and you need to postpone your exam. You have a reason, yes. Or there is, you are lacking a particular subject and you think, okay, my biostats or my social sciences, they are very weak. I'm getting 50% on this and then 80% on the others. Yes, you need some time, a week or two, to improve on that biostat, but you need to have something in mind. How am I going to improve this? Do you see a room for improvement? Do you see the resources for improvement? Because if you are delaying it for 2 weeks, you may improve the social sciences, but you may forget cardiovascular system. You may improve biostat, but you may forget respiratory system. So that is the thing, that if you are delaying, you are renewing one thing, but you are actually losing something else. So the most important thing for everyone is that you should avoid postponing your exam without any obvious reason. And for max, that should be once or twice. I would not even recommend twice. It should be actually one time. There is an advantage. I would give you an advantage of like the advantage, and then if you can do it, you just do it. But if you don't have that thing, no reason for improvement, no room for improvement. We have done everything, the requirements that are needed for the exam. Just go and take your exam. I told you earlier, you will never feel you are ready for the exam unless you go and you jump in the exam. And then once you are done with it, just come and then you will see when you will receive very good results. If you are doing uh, completely the prerequisites required for the exam.
Okay.
Mati pretty much covered everything I would have mentioned. One, at most one, do not delay. And only targetedly, if you have a solution, ask yourself, what will I do differently? If you can't, give the exam. Don't delay.
Yeah, that's a very important point. Like even if you have more time, you should be very clear about what need to be improved and how it can be improved. Other than there is no point of delaying it. All right. So we covered this. Especially, I just want to re-emphasize free 120 part. Everybody knows that it has a tutorial which is exactly similar to the exam. So it should be taken very close to the exam as well, like 3 to 5 days before. So you are aware about the how the interface works. If you have already taken Stefan, you know that how important this is to know, and also to take get a feel about like exam question, because exam is most close to free 120. There will be question like UWSA, there will be question like NBME, but free 120 a little bit like a little bit pinch of salt, more straightforward. You should be you should get familiar with it, and especially to save the 15 minutes on the exam day to edit on your own breaks, you should be get familiar with the tutorial part as well. So yeah.
I think, Arjun, I would add a teeny weeny advice here,
Yes,
and that
sure.
would be, especially when you are doing Prevent 20, make sure you listen to the heart sound so many times before your exam. Because sometime on the question, there will be that regular split during inspiration, and on the exam, you may say, oh, this is some pathology, and the option would be, and the option there will be an answer, normal physical examination. So make sure, I think, before my step one, before my step two, and even before my step three, I always heard the heart sounds, the normal heart sounds that were in the tutorial during the Prevent 20 many, many times, so that I know that in the system, if I receive this thing, this is the normal thing. And then if I receive the abnormal, if I know normal, then definitely it would help me to diagnose the abnormal one. So I would strongly advise to listen to the heart sounds so many times, so that you have a feel of how it feels during the real day exam.
All right, great. So I would like to notify everyone as we are nearing the scheduled time of the meeting, which is 1 p.m. So what I have done is like I have made a new meeting as well. So if when we'll be like when this meeting will be over, the link will work. I'm posting that link in the chat as well. Let me uh, do the chat thing. And yeah, where it is, please note it down. I have shared in the WhatsApp group as well. Just copy this link and put in the different tabs, so when this meeting is scheduled, it will be over at 1 p.m. You can join the new one. We'll be there, and we have a very, I think it's this half an hour thing to say about other stuff after the critical part is over. But we would like to join you, and we will cover the question and answer in that meeting as well. I will be saving the chat. All right. So, okay, any opinion on MBOS assessment? Very quick thing to say if anyone has to say.
I didn't give any, so no opinion.
I took the free assessment, which happens yearly. It coincided with when I started my first pass. It was okay. That's more like just giving it to see where I'm at. It is the questions are not the most representative of the actual exam. They're very fact oriented, and the question exam will not be like that. But then that's if you want to give one for just seeing and just sitting through 4 blocks, it's a fine place. And score value, no, I don't really know of that score, how correlative it is.
I
So
think
if
I
you,
personally
yeah,
have, I personally have no experience with the MBOS assessment as well, so I would not be able to comment on how well or not so well did it predict this stuff.
all right. So now the like exactly last phase, like the exam week, the night before, and exam day, like you have done your work. What would be the strategy for the last week exactly? So I would summarize the common point and input. Panelists will give their own input if they have something to add. First thing, like get into the circadian rhythm that is compatible with the exam. Like some you may be night owl like me, but you have to wake up early. You have to be alert in the morning at 8 a.m. So schedule yourself your sleep schedule, like going to sleep, waking up, everything around the exam time that you are supposed to take. And to help with that, uh, try to take help of exercise. If you do physical activity in a day, you will get tired a little bit easily and you will fall to sleep if you are trying to go to sleep earlier. Maintain sleep hygiene. That is like don't take coffee, tea, or any other caffeine things like in after the afternoon. So just to make sure that you go into the sleep initiation very easily, and take sleep medication if needed. So this is a very subjective part, very personalized part. If you really think that you will need sleep medication, either you are so anxious that you cannot fall asleep, or either you have a circadian rhythm that is not compatible with the exam, then consult your physician, consult your psychiatrist, and choose a whatever works for you. It may be melatonin, it may be zolpidem tartrate, it can be anything. But the important point to note over here is like don't do this the night before. No, don't do this on the first day, like the last day. Try out everything, whatever you want to do a week before. Try any medication you have heard about or whatever. But don't do that. Don't experiment, as Devam already said. Don't experiment on the exam day or the night before. If you have to take medication, uh, try out at least a week earlier. And as we said earlier, like simulate the whole exam with intended breaks, like washroom breaks, snacks, tea, coffee, and meal schedule, like after 4 blocks or after 5 blocks. At least once or twice during your preparation, but not in the last week. You don't want to get tired by running a marathon before the actual marathon, right? So do this during your last month or so, but not in the last week. Do that before. Any panelists want to add to this?
Yeah, sleep can actually affect your scores by -10, which happened with me. I was scoring 280s in all the assessments, and life happens. You somehow don't sleep the day. It is very important, and as I said, like it can change your whole score range that you were scoring. Uh, so try to work on it, but of course, be prepared for anything unanticipated. I always sleep at 9 p.m., and that day I couldn't sleep. So it can happen. It can happen to anybody. So just be prepared for unanticipated events. And all that you can do is maintain a proper cycle for at least, I would not say just a week, I would say a month in your last phase. A month of your last phase should be like a, as if a practice for your exam day.
All right. So we covered the medication part. Purvi, do you want to add anything? Sorry, I interrupted you earlier.
No, I just meant you mentioned a week before exam. I would say a month before exam. Uh, That's all I have.
Same. Try it a month before, so you know what you're dealing with.
Right.
Yeah. Try it early as early as possible so you know your strategy, your own strategy. All right. Burnout. Let's tackle one by one. One burnout and when to stop solving question.
I'll start with this. One thing you have to understand, a lot of us do, is if you feel you're burnt out, like you will know your cognitive function will feel like a fog. You're not seeing the questions right, nothing is going in. Take the break. You 1 day of preparation will not be if you lose 1 day of preparation, it changes nothing. You have been working out for 6 months at this point, usually. That 1 day is so minimal, but that 1 day of break can be life changing. Like 1 day of break lets you work again full throttle for almost 10 to 15 days at least, if not more. So take that break. I went out for a movie 2 weeks before my actual exam, and then I went out. I was stressed. Obviously, that's light. We are human beings. We are like we have an important deadline coming up. You're worried. What if I could do more? What if you could do more? But that 1 day break made sure that for the actual prep phase, I was ready. And you have to also remember that you want to end on a peak on the exam day, not be hitting the bottoms of your energy levels when the exam day comes. So learn about your body, learn about your energy levels, and take the decision as it is. And questions is subjective when you want to solve. I kept doing it till 1 day before the exam. You could stop solving it a few days before. It is up to you.
So I would strongly recommend against solving the questions, like just stop solving the questions. But what I did instead was I took that free NBME in that 3 days of break. So you kind of you're preparing, you have a feel of exams. Uh, you're solving questions as well. So I would say just stop solving, chill out, relax, revise your notes if at all you've made. Revise your notes, just scan through them, do that free 120 in those 3 days. But I would say stop solving UWorld at least.
All right.
I think if you ask me what you do, I actually from me there is no recommendation. Whatever you feel, just do it. Someday, if I'm in the last week, 5 days before exam, I feel like reading notes, so I did that. Maybe on the other day, okay, I'm done with notes, just do a block or two. So it depends on my mood actually. Whatever I actually felt about, I did that. So there was not a specific thing that I really stick to. Okay, I'm doing this, I'm doing that. So the way I felt, I just did it.
So I would say the basically the bottom line would be don't stress yourself out during the last week. Don't force yourself too much to do hard work. Whatever you feel like, whatever you are comfortable, do that. If you feel you are burnt out, if you have to take break, just take the break. Don't worry about studying till the last day of exam. I think that's the gist of it. Okay, let's cover the other resources. Like people always ask, like, what about this and what about that? So yeah. So what about the resources needed that as biostatistic is really heavy on step 2 and especially on step 3 as well. Like and sometimes people feel they are not that competent or like let's say confident in biostatistic after doing UWorld only. So what are the other suggestions to cover that part? So first and foremost, I think I will speak for everyone. UL Biostatistic Review. It's a separate module of 72, 73 question. And as biostatistic comes in all the steps, we would highly recommend doing that. The only catch is like you have to really read between the lines. You have to really understand the material. You cannot superficially go through it, but it is recommended every time, like before each of the exam, like whether it is step 1, 2, or 3. Panelist.
I
Uh,
agree.
I think I also agree. I had a very good experience with the Word by Statistics Review. I revised it after my every exam, step 1, step 2, and step 3, and it helped. So I would highly recommend it. Once you do it, you are kind of have a very strong grip on the questions. You don't take that much time on solving the real questions then. And I think just do it. And if you don't understand the first time, or you find it very hard the first time, just don't lose hope. Give it another 4 hours, do it the second time, and I'm pretty sure if you understand this well, you are going to do very well on the exam.
I want to supplement that, like if you sometime, yeah, biostatistics is really abstract. So if you are finding it hard to understand, I'm not talking about remembering formulas. If you are trying to find trying hard to understand or conceptualize it, Boards and Beyond's videos are really kind of short, but they kind of explain really well. So it is not a mandatory thing, but if you need it, just use that. They are not that like long or time consuming, and you can learn from it. Devam, Purvi.
Yeah, so I used a strategy for myself to solve the drug ad and abstract questions. What I did is first I did the biostatistics review to form a foundational knowledge about confidence intervals and the significant ORs and RRs and the risks and everything. So after that foundation, go back to the questions of drugs and abstracts. It is kind of easy to roll out at least three options by just looking at the significant confidence intervals and relative risks. So, what I did was I immediately went to the options and ruled out the insignificant confidence intervals, and then I used to go back to the question and read all over again. So that was my strategy to solve it faster. Like for example, they might give you huge abstracts, 2-page abstracts and long options, but if you just see the intervals, you might rule out few options straight away instead of wasting time. So that was my strategy.
Okay.
So I didn't use the UWorld module, but I did use a strategy which Poorvi uses a lot. That is, rule out options immediately if they're not significant. That all you're usually you're left with only two options, and then it's a simple matter of reading the entire document. I did use Kaplan biostatistics. It is around 30 pages of reading with few hours of videos, and that did help as a base. That's for my step one. I did it in my step one. And for my step two, the notes were there, so I just reviewed them again. I didn't have to redo it. But that was my base for biostatistics.
I think I would just add one. Somebody also asked in the chat question what to do about the abstracts. So if you go to the abstracts, there are basically three questions on every abstract. One question is about the results, one question is about study design, and the other question is abstract. So you need to understand that these are the every abstract that you get has these three components. It is more obvious in the step 3 freeway and 20 as well. If you can just find those 2-3 questions for your exam, just do then I would recommend do that. But you need to understand the three different questions and the three different aspects of the abstract. So if you come to know about a question that okay, it is about the results. So just try to find the answer in the results. And if you think it's about the study design, just try to find the answer in the study design. That way you can decrease or minimize the time it takes. And also, if it is asking about something that is significant or non-significant, you can definitely go and check the confidence intervals, zeros, ones, overlapping. And if you do all this, you can exclude some answers and the answer that you are confused on. Then if it is about a result, just go to the results. Even I am not pretty sure that I have forgotten, but when I was preparing for my step 3, I had a kind of formula that, okay, for usually for the first question, it is about the results. I would find the answer on the second page of the abstract. Or if it is about this one, I would find the answer on the first page of the abstract. It exists. I have applied this formula and I use it. You just need to dig about it a little more. But I am pretty sure about the pattern that how they actually design the abstract and how they ask about questions. So you need a little bit more work on this. And once you do it, then it will be very much easy for you guys to somehow do the abstracts. It is usually easier for the ones who are regularly in the research and they have read more and more articles. They can figure it out easily. But if you haven't, you need to understand what is the question about and where can I find its answer.
Okay. Shall we move on to other topic? Yep. I think we skipped one of the important part, ethics. So just to give the introduction, ethics and social science and step two, according the question distribution, it is higher than the cardiology itself. Like it is the most at the most question are will be coming from this ethics and social science. And as we are like majority of us are IMGs right now listening to this, we are not that aware about the US convention, US or ethics regarding medical interaction with patients and other medical legal stuff as well. So we kind of we are good with clinical, but we it becomes really hard to get accustomed to the US social science or US ethics. So what are our let's see what our panelists suggestion are for to tackle this difficult subject.
Yeah, I agree that we are not accustomed to the scenarios that we are posed upon, especially end of life care and advanced directives, everything. I think Conrad Fisher book, I found it really good to form at least a base of knowledge. After that, I felt that only step two question bank was not enough to answer the unanticipated questions. So what I did was I borrowed some offline UWorld Step 3 at that time, and I did go through the ethics and social sciences questions. Third thing that I did for myself was I had zero clue about what insurance, Medicare, Medicaid, Cobra, blah blah blah. I just could not understand from the written material of UWorld. Maybe I just could not grasp from it. So I did watch random videos on YouTube. Just type the insurance step to CK question or social sciences YouTube questions. You'll get nice videos, and they do help. They did help me to understand. Okay, what is the system like? What is the system like? What are the advantages of a particular insurance? Blah blah. Blah. So I would say three things that helped me to go out of the way. One was offline step 3 questions, the YouTube videos, and the Conrad Fisher book.
Okay.
So for me, I went back to my step one a lot. In step one, I used my first aid, my UWorld, the Conrad Fisher book, and BNB. And I had some notes either annotated into my first aid or kept separately. And during my step two, I revised those and made notes from UWorld of step two to add to that. And at the end, that was my revision strategy because there is nothing else to it. And of course, if I don't understand anything, like insurance was a major part, I would Google it, either read it online or YouTube it. Because it's such a vast topic, you can't, it's never ending. And it's all on the exam, they're telling you. I remember every block had a few questions. I had never seen 90% of those. I'm still guessing after all this. So you hope for the best.
Yeah, on the exam day, I also you always face the unanticipated questions and situations. So I would ask myself, what an ideal person caring most, your patient is your priority in your mind. What an ideal person or doctor would do. Leave what you've been doing till now. Leave that. So that also helped me.
Okay. So Madhu, you are muted. Yeah.
Yeah, okay. So for me, I think, as discussed earlier, social sciences, never you go with your common sense because our common sense is for our areas. Okay. So there's one of the mistakes that we usually do. We look at the question and we say, okay, so this is, I think this one is right. No, it's not usually the case because it's a different society. It has different rules compared to where we come from. So never use your common sense. Always try to and read all the options as thoroughly as you can, and then try to develop an understanding of the society based on the options or based on the questions that you do as much as you can. That is the only way to improve. Honestly, so many people ask me, so many juniors ask me, what is the best way to do social sciences, and I say as many questions as you can because there is not a specific rule that I can say, okay, take this book, or if the situation is like this, then you go with this. It's all about your practice and understanding of the society, and that comes when you are exposed to it. Since you are not here to get exposed and you are not in the system, The exposure that you are gonna get is from doing maximum.
Great advice, Mati. So yeah, more questions are always recommended, especially when you are dealing with tough topics like this. So all the UL question banks, 1, 2, 3, emboss if needed. So those things will cover the more questions. If you are lacking in primary base, you can use Boards and Beyonds, another book as well, Conrad Fisher book and 100 cases. I forgot the name of the author. And still, if you are finding it hard, you can definitely search on YouTube for specific topic like insurance and something. Somebody must have made videos for that. So in this sequence, you can take all this. And psychiatry. I think I personally, me and Purvi found really hard. I still find really hard to tackle this subject. I don't know why, because this and it is little bit different than the other clinical subjects. But what are your thoughts on it, Purvi? How to tackle this?
Yeah, so I think yes, step one, first aid is gold in this matter. I cannot, I do not personally very much like this book or resource, but for psychiatry, I would say it is gold. And second thing, what I did was I formed notes for myself. For example, it's every question or every option is actually similar to each other. So I did form my notes. For example, I formed again presentation or situation. Notes. For example, sadness after death. It could still be grief, bereavement, depression, blah blah. Every answer is correct given the time frame. So step one, first aid was gold for me, and then again I did some more practice questions from step three. This is like there is no right or wrong if you don't know it. Psychiatry is another subject like ethics. It is very clear, yes or no. There is no in between. So more the questions you do for your weak subject like psychiatry was for me, the better. And yeah, so step three was a very very good resource for the same. But for foundational knowledge for this particular thing, I think step one, first aid is more than enough.
I think highly recommended step one first aid, but just what worked for me in terms of psychiatry. I would say if you do not highlight the time duration, you are getting the 50% of the question wrong at the very beginning. If you do not highlight the timeline of the disease or the problem that your patient is presenting with, I would say, for example, a very simple question would be uh, brief, brief psychotic disorder, schizophreniform disorder, schizophrenia. Three diseases, almost similar presentation, only differentiated by timing. Less than a month, 2 months to less than 6 months, and more than 6 months. So if you are missing that first thing, that is the duration of time, or the patient XYZ came, he has been having symptoms for 8 months. And then you see all the three options. Oh, how have I to differentiate? The answer is there. Just go and see when it is. So timing is important in all the questions, but in terms of psychiatry, if you miss the initial duration of the disease, you are most likely going to get the question wrong. And that should be highlighted to make your choices easy and to give you like to lead you towards the answer. I just gave you one example, but if you see uh, grief, simple grief, and then persistent grief, and then the disease one, I actually forgot the exact name, but all these are based on the duration, the ICD-10 criteria. If this is the duration, you give it this diagnosis. If this is the duration, you give this diagnosis, and also setting of the disease, if there was a recent stressor or no stressor, something like that. But I would still say time takes the higher priority whenever you are solving any question that is regarding psychiatry.
I'll add this thing. Step one is again most important, is gold. Second, the time approach is critical. Every disease is defined by time. But there's one more few critical aspects. When you're reading a question, you see symptoms, right? Start counting. So many of the psychiatric diseases are simply defined by 4 symptoms, 5 symptoms. And you do not want to go back and read again the symptoms to count. Immediately start counting. Okay, this symptom one, this symptom two, this symptom three. You don't have to remember what it was, just count. Because with time and count itself, you already know 50% answer right then and there. And secondly, remember, no disease is a psychiatric disease till you have social or occupational impairment. Person might feel sad, lonely, whatever. He has no effect on his work. He has no effect on his social life. It is not a disease then. You manage it as some guidance maybe this and there, but no medication, no treatment. So that's a very critical segment. And lastly, psychiatry has two segments. One is a diagnosis, which we covered intensively already. Second is pharmacology. This is one of those things where you must know every bit of pharmac to know when to give the drug, how it acts, because that helps, and side effects, because sometimes four drugs are right, all four are correct. How do you decide what to give? The side effects. Some person is okay with a sexual side effect, you give it. Some people is not okay with it, you want to give a certain separate drug, like SNRI. But then if the patient has blood pressure issues, you cannot give SNRI. So side effects are also crucial. So those are a few things to keep in mind with psychiatry.
So those were the very helpful tips regarding psychiatry. I would be keeping those tips in my mind for my step 3 preparation. So thank you for that. All right. Allergy and immunology. So it's like a very tiny little bit, not exactly little bit, but tiny part of the preparation. Devam, what are your thoughts on it?
It is, see, if you want a really good score, like I am as always thorough. I like knowing stuff. Do step 1 again. Step 2 is not enough, but I have to emphasize whatever we mentioned about doing from step 1, don't read the embryo and add physio. Mainly focus on pathology and pharmac. Those are the things relevant to your step 2. So when you go back to allergy, you don't read the anatomy, what is an antibody, none of those. What is hypersensitivity, the complement disorders, all of those things. Because they mean that little bit of a difference in terms of your score, in terms of your understanding. So that way, yes, allergy.
Anything to add, other panelists?
No, I'm fine. I personally, I felt that step 2 was enough, so I don't have much to add.
To summarize, like I think UWorld was lacking in covering all the pathology regarding immunology questions. So the step 1 FA has like 4 or 5 pages of especially pathology tables. Those were good if you are able to diagnose based on that. I think that would be enough. Other resources. Quick comments regarding other resources. MBOS, as we already discussed regarding one common thing with MBOS, like if you are lacking in social science, do it. In any way, do it. Social science is necessary. For same with biostat, especially with drug at question or more practice regarding the biostatic, it is great. And it's apart from this, if you are weak in particular system and you are like out of question, you have done UL 2 or 3 times for that particular system, you can definitely try this, but it is not a first recommendation to do directly. But yeah, social science, biostatistics are great in MBOS. Same with step 3 UL. Both section can be used for step 2 exam as well. Now regarding library, so anybody has comment on that MBOS library?
I think I have used the library not like as a whole, but for example, if I would be making mistakes in terms of, let's suppose I would say, okay, somebody with pulmonary embolism, right? So if I say I am making problems, I having problems with pulmonary embolism, I'm getting that questions wrong. So what I would do is I would go to Google. I don't know if that feature still exists, so I cannot really be sure on that. But what I would do is pulmonary embolism, and I would say embos. Write in Google, and then the exact topic would come. You do not have to search in the library. Just click that and go. If you have problem in the diagnosis, read the diagnosis. If you have problem in the management, there are very good flow charts. So I would just go to flowchart in order to reinforce my previous knowledge. So I have used the library not that much, but at least for the topics where I find it confusing and where I think I am lacking a knowledge or I don't have a very clear cut path what to decide if a question comes up. So for those kind of things, just to remove that fogginess about certain topics in my mind, I did use Emboss library, and I think it worked for me.
Great. And yeah, there is one thing I like to add. Like, if you do like that, if you do the Google search topic name and emboss, and the the page link will be free. So you don't have to have a paid registration for emboss. Like, they have a feature like this. Like, you can simply try out that whole page, like 2 or 3 articles per day. And even after 2-3 articles, if you clear out your cookies in web browser, you can still again access another 2-3 articles. So you don't have to have a paid subscription to access Emboss library. If you need just like as and when needed only, if you need more, then you can definitely buy it. Boards and beyond. So I definitely vouch by it because I took my step 1 to both way after my graduation, and for some things I didn't have a base at all. For something, for example, for OBGY female repro, I knew nothing, and for some things I had base, but I like to revise. So I really found boards and beyonds excellent for to make a primary base like till that, like I would say, if you learn well from boards and beyond, you for that particular system you can easily get 85% correct on dual block. So if you are able to apply it, definitely it's not the same thing learning and applying, but it is that comprehensive, and I really love it. Obviously it depends on the style you are comfortable with, whether or not are you comfortable learning from a video, a monotonous video I may say, but it's up to you. I definitely recommend it. Anyone else want to comment on boards and beyond?
I would say that spend your time on boards and beyond in step one. Like, don't skip it. Do watch boards and beyonds before starting on your system-based UWorld block in step one. Get a good knowledge base, strong knowledge base, and then step two can be a cakewalk for you. So I do recommend boards and beyonds videos, but I would say do your homework in the earlier part of the step.
But what if someone was not aware about step boards and beyond during step one, and they are weak in particular system?
I hardly think there is anybody who will not be aware of boards and beyond videos in step one. But if at all that is the case, I would say quickly watch it before you jump on the UWorld blocks of your first pass. If you've never watched that, then it's a good idea to watch them.
Okay. Anyone else want to add on it? Then we can panelists can give. We already talked about a lot regarding step one first aid, but still, if anything is remaining.
I think I would say step one first aid. So it is like I used it. I mean whenever I used to go for my study to do CKU word, I always had my first aid with me. So I would have my laptop, which would contain the online U word, and then I would have my first aid in a small notebook to take notes. So these things were my study, and I would reference to it if I had some problems, and I did some parts which I have mentioned later on. We can do that. If you want to do good, there is always a line between doing very well and then doing well and then doing good. So if you want to do very well on the exam, you are aiming very high, then you have to do some extra, and then you need to make all the aspects of your exam that are going to be tested, even if there are two questions out of 320, but you have to have a grip on those two questions in order to score good.
I agree with what Mati said, and I liked it because I could directly jump from that correlation to the clinical aspects, so it helped me that. But I'd emphasize, don't read everything. Patho and
Yeah.
pharmac only, not the other stuff. That they're not relevant.
Psychiatry too. I would highly recommend psychiatry too.
Yes.
Like psychiatric does cover as patho and pharmac. When you say patho, I mean pathology, diseases, not the embryo and that physio parts.
Okay. Oh yeah.
Okay. So I will just say one line regarding step two first aid. Nobody has ever recommended it. I don't think anyone has ever read it properly as well. So skip it. CMS forms. So yeah, I personally think if you are weak in some subject, and let's say psychiatry, let's say OBGY, and you have run out of questions, these are definitely good practice. In my personal opinion, they are not very hard, or so not up to the difficulty level of the exam, but they address the important concepts. So even if the question format might be little bit easy than compared to NBMEs, both are made by NBMEs. Still, there will be good practice to hammer hard the commonly asked topic in NBME way, the angle they want you to see the disease. They are useful in that. Anyone else want to add on that?
Yeah, I have done the latest. I had done the latest CMS forms in my pastime. It used to be my, uh, a way of pastime that I would just sit along without any stress. You need a break, right? You need a break from the UWorld, your laptop, same screen, same setup all the time. So I used to use them as my break time, and yes, it gives you extra questions. It gives you uh, extra practice, but I faced some difficulty in the authenticity of the answers. Sometimes I did feel the answers are not very authentic or not very reliable. So what I did was, at least I got a concept from where, if I feel that this particular question the answer is not right, is not making sense to me, at least I got the concept and I could go back or fall back on the U word and justify the answer.
I would like to, sorry, yeah.
Go ahead.
Yeah, so the when Poorvi did this CMS forms, like at that time there were no official explanation from NBA. But nowadays, if you go on the website, if you buy the form, or if you found in some other way, I will not say, then you will definitely have answer explanation as well, like similar to UWorld. So then there will be no ambiguity regarding the correctness of answer, or like where NBME is trying to point towards. So yeah, it was a thing in past, like when they didn't provide the explanation, like they didn't provide the explanation for NBME as well. But right from like since past 1 or 2 years, they have started giving the explanation as well, and they keep on updating, not explanation, but like suppose the current form may be, last form may be NBME CMS form 5, or let's say 8 for medicine. For after a few months, if you see, they will update like form 9 and 10. So as per the current exam, as per the current trends, they like to focus on, they keep on adding the forms as well and removing the previous one similar to NBME. So because both are managed by NBME and written by NBME, so if you have a little bit of time luxury, or if you really need for a particular subject, I think general recommendation is to do it. But if you are already solid, strong, and scoring 270 plus just by doing UL like Mati and Devam, then you are fine. And we have talked about UL biostatistic module. I think everybody highly recommends it for all the steps. Okay. Enki or no Enki. So unfortunately, we don't have anyone over here who are like die-hard Enki fan. I think everyone here has dabbled little bit into Enki. I personally didn't find it useful for me, because it was kind of random things going inside your head, and you don't know where to put that knowledge on your current knowledge tree. So I didn't like that much. Anyone else want to add something about it?
I think I have no experience with Enki and have not used it, so won't be able to give any feedback regarding Enki.
The only thing I feel it helped in was step 1. It helped with biochemistry. It was very factual. And step 2, to some extent, I would say diuretics. And diuretics, and there's other segment about renal. There's some specific segments about how to figure out what diuretic the patient is on based on the urine constitution. Rather than that, didn't help me. It was too confusing and too haphazard.
So basically, it is very personalized. Only do if you really need to, or if it is your only way of learning things, then you should ask someone else how to go about it, because we are not good persons to guide about it. Anyway, now actually at the tail end, we are taking a very critical thing about step 2, which is step 1, and Mati will talk us through it, why and how important step 1 is for the step 2 preparation.
Yeah, I think this is a very important question, especially at this time where the step 1 is pass and fail. If you can uh, show the other slide. So yeah, why is step one important? Because as one of the panelists mentioned earlier, these exams are in sequence, and there is a reason they are in sequence. One is one, the other is two, the other is three. So they all are interconnected. There is one build your foundation, one takes you to the clinic, and then one makes you perform in the clinic. That is the step three. So these, if you do not have a solid foundation, you cannot build upon your step two preparation. Previously, there was score, and people would know, okay, if I did well on my step one, it means I have a strong foundation for my step two, and then you build upon that. But currently, you do not have that score kind of thing, that figure that tells you whether you have a good foundation or not. And that is where the initial part that I said, that the initial part when you are doing the first round award, that assessment part becomes even more critical nowadays. Because if you do not have a previous score on step one, and you do not know whether you lie at the 70 percentile or you are at the 95 percentile of the spectrum. So in that thing, I would say that assessment part of the question when you are solving a question in the step two CKU word becomes even more important. So I would say do not rush when you are preparing for your step one. If you have not taken it, give it the same time as you would do it for getting a score. Because if you do not give it the same time in your step one, you are going to give it during the step two CK preparation anytime. So that's where I said that if you have good foundation, that will decrease your overall time for step two. Now there are some topics that I would highly recommend from the first state of step two, for step one, that you need to do it on the step two CK if you want to do well. So it may not be for everyone if somebody has very strong grasp of the knowledge, but if not, I would highly recommend at least go once over the topics that I'm going to recommend before your step 2 CK exam. So for biochemistry, there are at least one or two questions on the pedigrees. So if you do not want to, if you want to forego the two questions and you say, okay, I don't want them, then that's another thing. But if you want to do well and you don't want to a single question, do the pedigree question and the genetic X and Y Z, that kind of, it's just one page probably, or maybe 1.5 page in the whole biochemistry section, that I would highly recommend to have understanding of that. In terms of allergy and immunology, no need to do all the basics. How is antibody formed? What is the structure of antibody and all those? But I would strongly recommend the transfusion reactions, transplant rejections, like where it is 1, 2, 3, 4, type 1, 2, 3, 4, and then the two important pages of immunologic diseases, the X and Y, the X-linked recessive and the X-linked dominant diseases about Westcott-Aldrich and all those kind of gamma globulinemia. Those 2 pages, 3 questions for sure. If you know those 2 pages well, you are getting to do 3 questions right on the exam. You are definitely going to get a minimum of 3 questions from those 2 pages in the allergy and immunology. So make sure you revise them before you go. Biostats and social sciences, as we all discussed earlier with the consensus that this is important, and it provides you a base on which you can build up your knowledge on. So biostats is, and the whole social sciences section is highly recommended from the first day. And then microbiology, the two flowcharts diagrams, I think if I now kind of start drawing those diagrams, I would be able to draw them at least 90% of the stuff on a paper if I do not get it 100% correct. This is why I'm telling you this, because this, I want to tell you how many times have I practiced to draw those flow sheets. Because sometimes you would make a whole diagnosis and everything, and you maybe like the question may take you towards something else, and there would be only one single line, gram-negative diplococci. So everything that you have made previously is, maybe it is confusing you with something else, but the answer lies in that one line, that is gram-negative diplococci. Or the answer maybe it was able to survive in bile salts or something like that. It was hyaluronic acid positive or negative. So those two charts, whether it is gram-negative rot, it is gram-negative cocci, it is giving this test positive, it is giving this catalase positive, catalase negative, coagulase positive, coagulase negative. I have drawn numerous number of times those charts, and I still have the sketch in my mind, and I would draw it. And based on that, you can get many questions right, even if you don't understand the presentation. But if you know some characteristics of the bacteria, you may still be able to get the answer right. It's always good to know both, but even if you mess up the first one or you are getting confused, if you know the factual things, that will get you towards the right answer. And I think about psychiatry, we all have already discussed in detail that this is a portion that you really need to revise. And also the parasite sections, especially the nematodes, the worm section, I would say it's important. Sometimes there are only one or two questions about, two, three questions about the worms in the step 2 CKU word, but that means you need to do the whole section. That just does not mean these two are important. You need to understand these two. So I would highly recommend the parasite section and obviously the mechanism of action of the drugs, because they would ask you at some point in step 1 they would like give you the name of the drug, like, okay, this was XYZ drug, what is the mechanism of action. And step 2, if they want to ask you some of the basics, they would lead you to a diagnosis. For example, I would say he based on the question, like he wants me to diagnose, somebody comes with fever and he has back pain, and he is leading me towards an abscess like SWAS abscess or whatever abscess XYZ, and you have to make the diagnosis based on the presentation. And then they would tell you not the exact name, they would tell you what would be the mechanism of action of the drug that you are going to prescribe. So based on that, you first need to make the diagnosis based on your knowledge, and then the mechanism of action of the drug. So if you can correctly formulate the drug for a particular diagnosis, you would know its mechanism of action. So these are some of the stuff that I think are highly recommended if you have time, but I would likely recommend to find out time for them to revise.
Thank you, Mati.
That's
Thank you, Mati, for the detailed review of the necessity of step 1 first aid and step 1 preparation before taking the step 2 CK exam. Okay, now I will quickly address few of the things that I repeatedly see on social media, maybe on Reddit, maybe on Facebook. Maybe you do have that question. So what if someone's knowledge base is weak? Because you may see, okay, you guys have good knowledge base, that's why you scored high, but what can I do? Because I was in your shoes, because my knowledge base was not that good. So what I did was, like, I highly recommend this course. The website is coursera.org. Some of you might have heard about it. It provides free course, and the course name is Learning How to Learn. It's like very little, like very small. It's not huge. Small course regarding how learning methodology with things helps in learning, and like how can we improve on that. So if you are struggling with improvement of your score and you realize that there is some issue with your methods, you can definitely refer to this just to get pointers or just to improve on it. And if someone's step 1 knowledge is weak, as we discussed, it is critical for step 2. We can definitely go towards whichever resources we used earlier. That can be Boards and Beyond, that can be first aid step 1 that we discussed, Pathoma as well. It is good for concepts. If someone is very weak in neurology, we highly recommend Kaplan videos, recorded videos by Dr. James White. The Kaplan year is 2014 to 16, but they are really good for all the concept. If you are good on concept on neurology, you will be good on pathology and clinical part as well. All right. Okay. And what if there is no progress? So I think we have covered this in chunks, but I just want to summarize over here. So if you think there is no progress and you are putting so much effort, then you might be encountering one of the issues. One most important thing that nobody talks about that much is mental health. If you feel that you are sad, or you are going under depression, you have crippling anxiety, anything, just don't hesitate, do consult your psychiatrist. If you are in US and if you are an IMG, you can consult a psychiatrist back home to find it cheaper, and have a teleconsultation and start treatment if needed. But mental health should be addressed really, really earlier, so not to prolong the exam duration, not to increase the stress. Other things that helps throughout the preparation is full and regular sleep cycle, daily physical activity. You will feel okay. You can definitely decrease 1 or 2 hours from your study time, but increase your physical activity. That will actually improve your efficiency and retention as well. Same with good diet. What is addressing root relationships? Like if you are somebody, you might be in, I have read lot of threads regarding this. Like somebody might be in relationship with a spouse or girlfriend, boyfriend, or they might be having issue with their parents. Like when are you taking exam, why are you studying so long? So whatever the issue may be, if we don't correct it, then it will go on and it will hamper your preparation and your efficiency, your pace as well. So if you have any kind of those issues, please address it, don't ignore it. And as I said earlier, check your learning methods, learn how to learn. And after all of this, if you think, okay, still I'm not sure why there is an issue, you can hire someone, a private tutor. And my focus would be here not to get content, because so many things can give you content knowledge, that is boards and meons as a Kaplan, that is UWorld explanation itself. But to learn from the tutor, like how to approach the question, what are your current learning issue. So method and approach should be learned from the tutor. And if you need it, don't wait for anyone's permission. There is no blanket advice that all tutors are bad or something. You can definitely get, I know many people that they can get it, definitely get benefit from hiring a tutor instead of just trying themselves. So it is a very subjective decision, and only you can be the judge of it. And I think, yeah, and just to cover it everything, don't follow the blanket advice. The whole purpose of this webinar was to give you different perspective and decide yourself what works for you. Ultimately, see, we are result oriented. If it is working for you, you are getting good score, you are having good knowledge, then you don't have to change it. Even if like we say something from loudspeaker, it doesn't mean you have to change it. If something is not working, then try out different things, and for that we are giving different perspective and views. Another thing I've noticed, like when you are near the exam especially, like some people are panic mongers or fear mongers, you can say. Like they just post a huge post regarding how the exam was tough, how it was different than usual. They are not technically correct all the time, but they just like to do that. So if you are someone who gets easily affected by those kind of stuff, don't just get off the social media, especially Facebook and Reddit, and focus on your own preparation and get help, personalized help if needed, from the trustworthy resources, maybe senior, maybe a private tutor. It's up to you. Closing statement. Anyone want to cover it?
Yeah, I can try.
Yeah.
So, this webinar, first of all, as Arjun said, I'll repeat, it was not it was not giving statements or advices or the right method. It was giving a perspective from four people's ends, what they did to navigate their way. Everybody is different. My Devam, Mati, everybody's lives were different, but we reached to a conclusion. So today, I think after we end, you can think for yourself what works best for you. Information is not deficient. Information, the problem is information is too much. What you need to understand is how to integrate that too much information into your small brain and then be able to give the exam in a setting like that. So concise information is what you need to derive from the sources. You will also, sometimes I think it just goes on and on and on, like imagine 4,000 questions, it just never ends. So how do you concise that information is really what makes a difference. And again, I would not be stressing enough, small concise notes which you can read for yourself. If you yourself cannot revise from those notes, it was mere waste of a number of hours that you did before. Experiment your own style, find your own style. For few people like me, maybe 3 blocks a day would work. For some people, 1 block a day would work. So find your own style. Experiment your own style, focus on understanding the concepts. No question will be repeated in the exam, so just understand the concept. And what I also wanted to mention in the previous examples where we were navigating the questions, I would, for example, arterial thrombosis, arterial embolus, cerebral ischemia, blah blah blah, so you had 6 options. How would the question stem change that the answer would become cerebral ischemia? How would the question stem change that the answer will become thrombus? Is what you need to understand to gain maximum from the UWorld. Same question, same patient. What extra thing would be in the question that the answer would change? Is what you need to get from that long or lengthy explanation that you have from the UWorld. Over the period of time, the trends have changed. No longer cardiovascular system or neurology is the most important. The most, you have to evolve with the trends and you have to evolve with the time. Ethics must important. Biostatistics much more important than before. Social sciences much more important than before. So keep updated with your trends. We tend to focus on the medical knowledge, but I would say 70-30. It's becoming like huge chunk of your questions which is not medical at all. So try to keep up with the trends of such offbeat topics. I would say offbeat for us because we've never encountered before, at least in the countries that we come from. So try to keep up with the offbeat topics as well. And I would say just prioritize your time such that you strengthen your areas of weakness, and just not keep on repeating, keep on practicing the things you know it. You've done your step one nicely, you know it. So prioritize your time such that you get out the maximum from your areas of weakness.
Nice summary, Purvi. All right. So we are finally at the end of our discussion. I will check the previous session's history for the question asked. If there is, I doubt we missed anything, but still let me check. Okay. Chat and okay. For reading aspect, does FA for CK useful? We covered it. No, not that much. What notes to use other than step 1 material to study for step 2 while doing UWorld? So as we said, like, you can develop your own resources or you can try out different things and see what works for you. There is no single recommendation for it. What would be your advice for last 2 months of preparation? I think we covered it in detail. What were your timeline for CMS forms and NBME? We covered in detail. How to supplement UWorld during this time? We covered and emphasized in detail that UWorld needs to be done along with the parallel revision. How to approach drug aid and research abstract? We, without losing so much time, we covered excellently. Just okay. And somebody asked, like, just 2 blocks of exam preparation is enough? So it's like a daily thing, and it's up to you whether you can do 2, 3, or 1. And yeah, that's about it.
There and there itself. So.
Yeah, so that's about it. And thank you for joining us. We apologize for a little bit length of the webinar. We thought that it needs the topics needed to be covered. And we will be uploading this webinar on the YouTube very soon. And you can follow our social media, Helping Hands of USMLE. You can simply search on YouTube and Instagram. And you will be finding links for the future webinar, uploaded YouTube videos, question and answer, and which are help. Or even you can reach out to us via that. And we look forward to seeing your next one. Thank you. And next one would be regarding the ERA CV preparation. So anyone going through the current application cycle, they will definitely get benefit from that, because the current ERA CV is little bit changed compared to the previous years. So hope to see you soon. Good night.